Chair sees a quorum. Anyone here wishing to speak for or against the bill, please sign up. There's a sign-up sheet back here in the back. So if you want to speak, you must sign the sheet. All right, committee, we've got a short agenda, but a very important agenda. So I will do my best to give folks the opportunity to present their opinions so that you'll have all the information that you need to make a good decision. That's my goal. So with that, we will go right into the agenda. And the first bill on the agenda is HB 1001. Representative Wardlaw, you're recognized to present your bill.
Thank you, Mr. Chair. It's been a few months, so I might be a little rusty at this. I get used to it again. But I have Mr. Jim Hudson with me from the department, and I'll let him introduce himself for the record.
Yes, sir. Would you please introduce yourself and who you represent?
Good afternoon, Mr. Chairman. Jim Hudson with the Arkansas Department of Commerce.
You may proceed.
Thank you, Mr. Chair. This bill is pretty simple. You guys know back in end of May, the governor issued a proclamation that we would stop the extra payments to unemployment. With that was followed with a lawsuit. The lawsuit said the governor basically didn't have that authority. So what we're doing here with this bill today is we're basically affirming that decision that we want to stop those payments, and we're giving the department the authority to say that. You know, at one time during the pandemic, I'm on record numerous times trying to get people help, and there was need for that. People were laying folks off left and right. We had lines at our unemployment office. We were open on Saturdays, as we all lived through. But now it's a time for our state to go back to work. If you drive down the street today, every business on the street says now hiring. So what we want to do with this bill is make sure that we're not incentivizing people to stay at home, that we're incentivizing them to get back out there and go to work and to help be prosperous citizens of the state. And with that, Mr. Chairman, me and my witness would be glad to take any questions from the committee.
Sir, do you have any comments?
Mr. Chairman, I think Chairman Wardlaw actually did a pretty good explanation on that, so I'd just take any questions the committee may have at this point about the bill. Happy to explain any of the finer points about it that the committee may have questions about.
All right. We do have a couple questions. Representative Payton, you're recognized.
Thank you, Mr. Chair. Representative Wardlaw hadn't had a chance to really study into the weeds on this bill. Can you just give us a synopsis of if a voluntary program exists and the Executive Director of Workforce Services decides to participate, what checks and balances or controls would the General Assembly have on that decision?
That's a fair question. You know, with JPR subcommittee, which is an investigative subcommittee, if there was any program across any state agency that we wanted to ask questions about that were joined into, we could call them before JPR anytime. Council also reserves the right to have any department come and for review purposes to have them explain any program to legislative council. And as you notice, General Berry, Representative Berry, I think he's in the room. He likes to be showed all the time. He passed a bill that forces all the secretaries to come basically give a state of the agency in council. We just went through last week the first round of those, and that's another place and an opportunity for the legislature to have a weigh-in opinion on any program that those agencies tend to get involved in.
And I appreciate it.
And the other side of it is, and I bring it up, thank you, Jim, we talked about it a while ago, but it's the appropriation process. So when we go into the fiscal session here in a few months, you'll be able to weigh in through appropriations on any of those programs that you wish to or wish not to be involved in by holding or not allowing the appropriation for those programs.
And just to piggyback on that, Representative Payton, when these programs commenced, we had to come to ALC and get appropriation for the program. So that appropriation was also conferred contemporaneous with the commencement of the program. So that'd be another opportunity for the General Assembly to weigh in.
So if I may, just, in other words, proactively, before a new program can exist, you would have to come for appropriation.
Yes, sir. And where those would exist outside of the session realm would be through peer and council. So anytime they would have to have a new appropriation, typically the way that works is they transfer the appropriation ability from one agency within the Secretary Department to another, and they do that in peer. So those will become for the legislature that way as well.
Okay, thank you. Thank you, Mr. Chair.
Representative Gonzalez, you're recognized for a question.
Okay, thank you, Mr. Chair. Representative Wardlaw, we are talking about federal dollars that go into these programs, right?
We are.
Okay.
Those federal dollars still have to have an appropriation through the legislature, though.
Okay. All right. I'm going to support this because I think it's time that we get back to some sense of normalcy and people get back to work. But don't you think it's a little bit hypocritical that we're calling for an end to this federal money for the people when we would not call for an end to the previous emergency because there were federal dollars coming into the state?
I don't, because at the time that we were going through that emergency, we had everybody was laying everyone off to work. At this time, we have everybody trying to hire folks back out of their homes. So it's a different time and a different environment in our society. And because of that, we do not need to incentivize these folks to stay at home.
Well, follow up, Mr. Chair. Yeah, I mean, just to clarify, I'm not talking about, I'm talking about we held on to the emergency because of the money that was coming to the state. So we held on to that for as long as we could because we had additional funds coming to the state. But these federal funds are going directly to the people, and we're talking about cutting that off early. I mean, like I said, I'm going to support this because I think it's time we get back to some sense of normalcy and people get back to work. But
We
I also
appreciate
think
your
it's
support.
a little bit hypocritical. Thank you. Wouldn't you agree?
No.
Representative Allen, you're recognized for a question.
Thank you, Mr. Chairman. Representative Wadlow, thanks for the bill. I have some questions about it. If you recall, when the money first came to the state of Arkansas, it was to be used to help those employers that had employees that were laid off. This money was to help with their unemployment benefits. Is that correct?
That is correct. It was an add-on onto their regular unemployment
It
benefit.
was an add-on to the regular unemployment. So what's going to happen now that the pandemic is back and this incentive is not out there, and many of those businesses that need employees to come back to work, they're not coming back to work, but I want to know what is our plan in case this happens again?
With this bill, what you're doing is you're giving that authority to the director. So you're allowing the director to have the authority to make those decisions depending on the environment of our society, as I called it earlier. So you're not saying terminate with this bill. You're giving that authority to the director, and we're saying as a legislature, we're backing up that director to make those decisions. Did I?
Yes, you can have follow-up.
Okay, thank you. What is perhaps we feel that the director is not moving in the best direction of the state of Arkansas? What consequences or what alternatives do we have that would guarantee us that what is happening is going to be in the best interest of all Arkansans?
If I may take that question, Representative Allen, I think the governor's expressed himself, on several occasions that we want to be prudent. We want to encourage good practices. We want to encourage vaccinations. But we also have to find a way to live appropriately with this pandemic. And so to be able to encourage people to not have a shutdown, that we don't put a pause on our economy. There might have been some weeks very, very early on where that made sense. But we're now well over a year into this thing. And so we need employees back in the workplace. We don't need to have anything from a policy perspective that discourages them returning to the workplace because there are consequences that are getting created for the economy of Arkansas by not being able to provide services and manufacture products. And so I would say if you believe, this body believes that there's an opportunity to reinstate these extraordinary voluntary benefits, and they are extraordinary, we've never seen them before, then y'all always have the ability to call us before you and to express your displeasure with a particular situation, and we certainly have to hear that.
Thank you.
So to answer your question, Mr. Chair, if I could, through JPR and through council, we have the ability to make that voice heard. And that was the same answer I basically gave Representative Payton to his question. We still have a lot of authority, and the appropriation process through peer can also be used as well.
Representative Allen, did that answer your question? Okay. All right. Any other questions from committee? Okay. Something we don't normally do, but I'm going to allow it today is there any questions from members of the legislature that are not on the committee? Number 27, you're recognized.
Thank you, Mr. Chair. Joy Springer, representative. I would just like to know what other data do you have that supports your position that it's time for persons to return to work other than it's been a year, and that I think it's been said that the unemployment rate is not as great as it has been, but what other data do you have, for instance, like are these businesses and other facilities equipped and have the necessary things to prevent the transmittal of the COVID-19? Have you done a survey in order to do that? So can you share with me additional information you have in support of this? Sure. And so that persons will not be exposed to the virus?
Sure. Well, first of all, if we do have in our employer community, bad actors, and certainly that's always a possibility, under the current Department of Labor regulations, if someone does not go to work because of that, that would be a justified reason to collect unemployment. So employers are providing the incentive to have a healthy workplace, and we think our employer community wants that. They have been dealing with this along with the citizens for this past year, and they are ready to get back to normal as well. There's been lots of programs put in place that this legislature has funded, and we're grateful for that. That's allowed us to give assistance to these companies so they can buy PPE, so they can buy things to kind of keep the workplace sanitary. An employer and a company, they are the most motivated to maximize, their business operations. And so they have the greatest incentive to ensure that people, are coming back and that they stay back. I suspect we've all experienced anecdotal evidence going to a restaurant and a restaurant, telling you, you're going to have to be patient with us tonight because we're short-staffed. Or a restaurant's telling you we're having to close a few hours early because we don't have enough staff. That's occurring all over our economy, and that's creating, I think, a burden for employers and a burden for the citizens. That's a concern we're trying to address with this.
Follow-up, Mr. Chair.
I'll give you one follow-up.
I'm still trying to figure out what specific data that you have. Have you gone to different businesses across the state and determined what it is that they've done in order to make sure that the businesses are safe? I heard you make a statement, but have you collected it in data is the question.
You asked if I have a survey of businesses, what exactly they've done. I don't have a survey, but we are constantly in communication with our employers in Arkansas about what's going on in their workplace and the measures they're taking.
But it's not in a writing.
So I'm sorry, ma'am, I couldn't hear you.
It's not in a writing, a document.
I don't have a document to share with you, no, ma'am.
Representative Allen, you're recognized for a question.
Very shortly, what assurances can you give us that if we pass this today, that the employees are going to come back to work?
I think, Representative Allen, there's no assurances. There's just incentives that will leave, and I've already left at the governor's order, that will not incentivize people not to come back to work. So that's the point, is to stop the incentives from people not working.
Okay.
Representative Allen, was you done? Representative Scott, you're recognized for a question.
Thank you, Mr. Chair. Representative Warlaw, I don't know if you, the director, can answer this question, but is there any way we can get a status on what the current update is with the unemployment claims that we had previous to the extension date being final, I guess, which was like end of June or July? Do we know how much backlog we still have for those Arkansans that are still waiting on unemployment benefits? And if not, can somebody just provide that information to us if we don't know that number?
We can provide that to the total membership.
Okay,
We'll
thank
get that from the department and get it out. But there still is
There's
a
still some backlog.
There's still a backlog, and we'll get you the numbers.
Like thousands, probably like, I know it's I know y'all been really working on it, but we're still getting emails, so that's why.
Yes,
I was
ma'am.
kinda asking.
We track that. That's part of our dashboard. Those numbers have come down substantially, but it's still in the several thousand range.
Okay.
Because there's some complicated issues that go with some of those claims.
Okay, thank you.
Representative Ferguson, you're recognized.
Thank you. Based on the court decision, I know this bill won't be retroactive. What will happen to that July, the 30 days? Will those recipients be paid retroactively, or what will happen?
Representative Ferguson, the bill is retroactive. It does have a retroactive effective date to May 19th, 2021. Obviously, we're in the middle of litigation, so I'm somewhat limited as to the things that I can say in an open session about that. But we believe that we have a very strong case on appeal, independent of this bill, to affirm the decision the governor and the director made. We do not believe that we'll have to go back and retroactively, pay those benefits, but that's still subject to litigation. We think this bill is a great affirmation of the decision that was made, and it would be a helpful act, we think.
So you think the bill will take care of that then? Okay, thank you.
It will help the problem, yes, ma'am.
Okay, thank you.
All right, we have no one signed up to speak for or against the bill. Is there anyone in the audience who wants to speak for or against the bill? Seeing none, Representative, are you ready to close for your bill?
I am, Mr. Chairman. I won't belabor the point. I'd make a motion to pass.
Have a motion of due pass. All in favor signify by saying aye. Aye. All opposed, nay. Ayes have it. Congratulations, your bill is passed.
Thank you, Mr. Chairman and committee.
Okay, committee, we're not going to take any action on HB 1002, so we'll go right on to HB 1003. Representative Mayberry, you're recognized to present your bill.
During the interim, I understand it's taking questions from non-members, but we're in session.
I asked staff, they said, the staff said that we can take them in special session. Now, I'll check with Buddy after this meeting, I wasn't sure.
I just talked to Buddy.
Okay, would you all please introduce yourselves and who you represent?
Okay. I'm State Representative Julie Mayberry. I represent District 27.
There, you're on. Yeah.
Yes, sir. I'm Glenn Fenner. I'm the superintendent of schools in Marion, Arkansas, and I am representing the Marion School District.
I'm Dr. Heather Young. I'm a pediatric infectious disease doctor, and I'm here of my own accord.
All right. Representative Mayberry, you're recognized to present your bill.
Thank you. Members, I want to keep my remarks as brief as possible because I feel like we have experts in the field who can share their thoughts far more than I can share their thoughts. But I know there are lots of things that we can agree on here today. And I think we can all agree that what we had last year with mask mandates, that every child in every situation all day long for the whole year on every campus, regardless of the infection rate and the possibility of a child getting COVID or a staff member, that was excessive. I hope we can all agree on that. I hope we can also all agree that we don't want to send our kids home. If you look at our test scores from this past year, they plummeted. Our kids, when they are sent home, they're isolated. We have mental health issues because our kids are not in the social environment that they need to be in. We have kids that are home who are home because either they're sent home to be on quarantine and they're not sick, or they're sent home because they are sick, or they end up going to Children's Hospital now. The situation we have now is different than what we had last year at this time. The kids are sicker. Then on top of that, when a child goes home, the parent also has to go home. So that nurse that was staffing the hospital, taking care of your loved one that is there, whether it's for COVID or car accident or a heart attack, now is not there. And we know we have a nursing shortage in our hospitals. I'm bringing forth an idea. As many of you know, I'm open-minded. I'm willing to work on this. If you have some other ideas at the end, I'd love to hear them. If we can tweak this a little bit more to make some of you feel a little bit more comfortable with it, I'm open-minded and we can do that. We don't have to take a vote today. I'd love to take a vote and get it passed, but I understand what I'm facing and the reality of it. Let me tell you what this bill does. This bill does not say every school district and every school board can mandate masks. It narrowly focuses it down to specific school districts that we know over a 14-day period of time have had at least 50 cases of COVID infections in their school district. Not in their county, but that's as locally as we can get it. So we know those are hot zones. Why would we not want to give that school board the ability to add one more tool to help protect those kids, to keep them free of infection, to keep them in the school and keep them learning? That's all I'm asking. There are some other safeguards in here. First of all, keep in mind it is the school board, not the superintendent. It's very important. The school board would be voting on it. That's as local of a representative as you can get. Then on top of that, if they vote for it, there are other guardrails there. So that would be that it can't be longer than 60 days. If a school district wants to do it for 30 days, they can do it for 30. But they can't do it longer than 60 so that in the end, we don't have a school district all year long, regardless of the cases, regardless of the circumstances, they're still asking your kid to wear a mask. Then we specifically put in their language to make sure that we understand that this is one layer of protection, but beyond that, if you can keep physical distance from each other, then that personal space should be allowed, and you may not have to wear the mask. For example, if you're in a gymnasium and you have 30 students in the classroom, okay, that gymnasium is huge, and those students can spread out, and they won't have to wear the mask. If they're on the playground and they're outside, they may not have to wear the mask. If a teacher is in her classroom by herself, she doesn't have to wear a mask. There are circumstances that are different than last year. Last year, they were told, regardless of circumstances, they had to wear it. Then another thing that's in here is there are some people who have a medical reason or perhaps a disability that it makes it difficult for them to wear the mask or could cause more harm. And so we want to make it clear that in those situations, we're not going to have the child with autism that has severe sensory issues towards something on his or her face have to wear that mask, because we understand the risk versus the risk versus benefit. Thank you. Okay. That's the gist of this bill. Again, I'm open to some ideas. I was told by a legislator that I have a great amount of respect for, and I shared this with many of you in this health committee when I brought forth No Patient Left Alone. I shared with you that this legislator told me, how do you know when you have the right bill? And it's when everyone feels a little uncomfortable. And that's the balance that I'm trying to find. And so I'm going to let our Marion School District Superintendent speak now because his school has already started and they've got a disaster there and you need to hear it.
Yes, thank you, Madam, and thank you, Mr. Chairman, members of the committee. This is my 40th year in education. I'm not representing, again, any group other than the Marion School District. I understand there are a lot of different opinions on this topic. My only qualification for being here today is that we did start school 8 days ago, and we've had some extraordinary experiences. I understand full well, just as the gentlemen who were here previously, that there was times continue to evolve, and there were things that we did legislatively maybe in the last session or even prior to that that were a part of the reality of the day. I'm simply here to tell you that the reality of the day continues to evolve. And the best barometer for that evolution, I think, is the experiences that schools are going to have once they reconvene. We started out with a very good concept, one that we're very proud of, that basically is a hybrid school calendar that allows us to start early, go basically for 9 weeks, and then take a 2-week break, and then another 9 weeks, and then a 2-week break, and so on and so forth throughout the year. It's designed to improve academic retention. So we were very, very excited about a chance to start that calendar this year. Our experience with the calendar has been great, but the experiences of starting school early have reminded me of my first marriage. Everything was pretty fun for a day or two, and then it started deteriorating rapidly. Our first week, we culminated with 10 people who had been proven to be positive on staff or within the student body, and we quarantined 168. The second, 2 days into our second week, we have 27 positive cases, and we have quarantined 562. That was as of last evening. Our cumulative quarantine number is 730 as of yesterday. We've had 34 positive cases within the students and 9 positive cases within our staff, and I was told just a few minutes ago that the numbers continue to rise rapidly. My concern, obviously, is this. I can't teach our kids if they are quarantined. I think it is important to understand that if our students had been under the same mask mandate that we administered last year, instead of having 730 people quarantined, we would have had 42. So those remaining students who weren't the part of the 42 who were tested positive would still be in school today. They would be learning, and we would not be disrupting our economy with those students being sent home and their parents having to assume the immediate responsibility for not only monitoring their activity, but supporting their academic endeavors for that time of that quarantine. My concern is that there's nothing special about Marion, America. I am afraid that this is going to be the response that you're going to see all throughout the state. And it is one that I am confident was not envisioned at the time of passing the original legislation. We simply need the ability to protect our students as best we can, and we're certainly prepared to accept the responsibility for what we believe to be the best actions at our local level. If we simply could have a chance to let our community and our medical professionals decide what is best for keeping our students in school, then we would feel this would be a move forward. I can tell you, if nothing changes and our numbers continue the direction that they have appeared to be headed, we're going to have another school year where students don't learn and have another interruption in our economic evolution in terms of our progress. And it's not going to be just happening in Marion, America. It's going to happen all over the state of Arkansas. And I'm simply asking you to contemplate those circumstances as you move forward in helping us figure out how to do the best job we can in educating our children.
So, thank you for having me. Am I on?
Yeah, you're recognized. Proceed.
So thank you for having me. Thank you, Representative Mayberry, for working on this bill. So I'm a pediatric infectious disease doctor, and I want to again state I'm here purely of my own accord and not representing any institution whatsoever. The biggest concern that parents have had when they have come to me to ask what to do with their kids is, what do we do with school? What do we do if we can't have masks in school? Or there are parents who are concerned about children wearing masks. And as far as children wearing masks, the one thing that we have seen throughout this entire pandemic is that they're an inconvenience. I mean, I don't really like wearing them, but I'm going to keep wearing mine. But they're an inconvenience, but they don't harm the child. We have not seen any children being hospitalized as a consequence of wearing their mask. But right now, with this Delta variant, we are seeing the rates of COVID positive children in our hospitals rising astronomically. And the other thing is, we know that children do best learning in schools, that they do best when they have social interaction. I am a product of Arkansas. I was raised here. I went to high school at Russellville High School, and it was there that I got to do an anatomy and physiology class, and that's where I decided I wanted to be a doctor. And there is no way that the experience that led me to that was dissecting a cat in my anatomy and physiology class. And you cannot dissect a cat doing remote learning. And I don't want any child deprived of those experiences that would make such an impact on their life, and for them to just be sitting there watching as, I don't know, somebody talk at them on Zoom. So if you have children and they're able to wear masks safely, which they are, and that is able to protect them. And if you have one child who walks into your classroom and that child is sick with COVID, but they're wearing a mask, then all of those COVID particles stay within that mask, and maybe a handful will leak out. But then all the other kids in that classroom all have a mask on, and that prevents those COVID particles from landing on their mouth and their nose and getting into their system. And so because of that, if you have a child who comes into your classroom as positive and is masked, and everybody else in that classroom is masked, no other kids have to go home. They're just the child who's sick. They get to stay out. So from a local perspective, it would make sense to have conversations with the pediatricians and the family practice docs and the nurse practitioners who work and serve that school district, and to have that conversation with the superintendents and the teachers, and to come up with what is best for that school district, and not just leave it to some blanket mandate or anti-mandate that has been passed. So.
Any additional comments? All right. Representative Allen, you're recognized for a question.
Thank you, Mr. Chairman. Representative Mayberry, thank you for bringing this bill. On the bottom of your bill on the first page, it encompasses kids that are 12 years and under. Is that correct?
That is correct. Representative Allen, my original bill included all school-age children, and I'll even share that it did include college. But because the governor's call specifically said that language, I had to make it match the call so that we could even have the discussion here today.
Okay. Well, it appears to me that we are picking and choosing which kids we are going to protect and the ones that we're not going to protect. As a member of the General Assembly, the welfare of all our kids is our responsibility. So we can't pick and choose which ones we're going to protect because the virus does not pick and choose which ones it's going to impact. So unfortunately, we have kids that come to school with underlying conditions, especially our special need kids. It is our constitutional duty that we protect the health, education, and welfare of all our kids. Would you agree?
I would wholeheartedly agree, and that's why my bill included all school-aged children. So I do agree with you, but we are limited by what is in the governor's call, and that's why this bill specifically says that.
Follow. Would you also agree that our kids can't protect themselves, so they are dependent on us to protect them?
Correct.
Thank you.
Representative Payton, you're recognized for a question.
Thank you, Mr. Chair. So Representative Mayberry, in paragraph 5A, it's where you line out the qualifications for a school district to make this decision. And it says infection rate of 50 new cases in a 2-week period within the school district. But that's not just talking about kids or teachers. That's talking about in the public, anybody that lives within that school district. Is that correct?
That is correct. So I live in the Sheridan School District, and if I got COVID, I would go down as one of those cases.
Okay,
So that is as close as we can define it is by the school district. The original idea was county, but county is so broad, we wanted to at least narrow it down to the school district. So all that is to allow the school district to consider it. Again, if the school board says, you know, the cases really aren't here on our school campuses, they don't have to consider this at all.
If I could have a follow-up, Mr. Chair.
Yes, you're recognized.
So I have a couple of concerns with that, but I'm going to move on to if that's the criteria, how many school districts in Arkansas are currently qualifying for this?
So currently, it would be 100 school districts in the state that meet that criteria. I do have Dr. Joe Thompson from the Arkansas Center for Health Improvement as the one who, their organization is the one that put this data together. I don't know if that information, I know it got emailed, I don't know if it can be shared broadly. I'd be happy to have him come up if you want to talk more specific about data, because that's where that source is from.
Representative Mayberry, we do have that information. Dr. Thompson, if you're just going to be presenting information, if you would go ahead and come up, and we'll pass this handout out, and maybe you can help answer some of these questions. So if you would go ahead and pass that handout. Dr. Thompson, please introduce yourself and who you represent.
Sure. Dr. Joe Thompson, President and CEO of the Arkansas Center for Health Improvement.
Would you like to try to answer that question?
So, Representative Payton, could you repeat the question just so I make sure that?
Well, my question was, based on the data that we currently have, how many school districts would come within this guideline?
So you will be getting, you should have a graphical map that our center published last week.
We're passing that out right now. You get it.
That of the 282, I think it is, existing school districts in the state, 100 would be above the 50 per 10,000 threshold. And I want to offer a correction. It's 50 cases per 10,000 residents in the school district. So it's a rate. So it's equal to, a large district has fewer people, but the rate lets you look at the same way across all school districts. This 50 per 10,000 is 2.5 times higher than the CDC recommendation threshold for mandatory masking. So this is a high threshold, and at the present time, 100 of our school districts are above the 50 threshold, and 12 are above the 100 threshold. 100 per 10,000 means that 1% of all the residents in that school district have been newly diagnosed in the past 14 days, 1%. So that's the data that we get from the health department. We geoplot it onto the school district boundaries, and we generate that rate, and we publish it weekly on a Thursday for public consumption.
So if I could,
Yes, you can have a follow-up.
so I'm just judging by the thousands of emails I've gotten in the last 5 days, basically. Do you have any concerns that a community would be disincentivized about getting tested and checking out positive? Because it seems to be an overwhelming majority of the community that does not want to have a mask mandate. And this could actually have a negative effect on our encouraging people to get tested and treated.
So I'll try to reserve my comments for when I've signed up to speak in support of the bill. I don't think any of us want to have a mask mandate or even have a mask period. But having said that, we stopped reporting back in March when the testing rate got so low that I did not have confidence that we could give accurate information. After the 10 days of snow that we had, the testing dropped off and it never came back. We looked 2 weeks ago and the testing rate was back up around 50,000 tests per week. So the most we ever were about 70,000 tests per week, 70, 75, and so we feel fairly confident. I would say these numbers probably underestimate the risk in communities because there are communities that don't have much testing going on. So this is the floor. The risk in these communities is probably much higher than what we're showing here, but I have a confidence that we're at least able to project most risk in a way that is reflective of what the true risk is in the community.
Thank you. Thank you, Mr. Chair.
Representative Pilkington, you're recognized for a question.
Thank you, Mr. Chairman. This is mine. My questions are directed towards the superintendent. I was wondering, could you kind of walk me through what type of COVID protocols you had in place before school started, such as temperature checks, things like that?
Before school started or when students arrived?
I would say on the first day when students started arriving, were there any protocols in check?
There are a list of protocols that were provided to our parents, to our bus drivers, to our faculty and staff in terms of monitoring students as they arrive at campus. If you've been on a school campus that has 5 locations and 4,000 students, some of that is a little more art than science. But at the end of the day, we have not only done that, we have offered, today is our 3rd shot clinic. We have created a health clinic on our campuses that are there and available to screen students regularly. And we share a regular update daily with our parents and our community as to what to watch for and the kinds of things that they should be concerned about in terms of monitoring the health of their children. Then we have a full complement of school nurses who are involved in screening as well. And these quarantines are something that are not done lightly, I can assure you. Our folks are well trained. They're in constant communication with the Department of Education and their liaison to the Department of Health. The last thing we want is to do anything that doesn't reduce those quarantines, obviously. And again, even in our shot clinics, we've been offering incentives, big screen TVs, gift certificates, groceries, whatever you can imagine to have people bring their young people in for shots. Until today, the turnout has been maybe 50 at an event. I understand that the event we're having today has a few more folks than that attending. I think that a part of that is we've been sharing the information about the quarantines. But in the meantime, while all this is going on, those quarantines are keeping that 700 odd students out of school and certainly keeping them from being in as positive an environment as possible. And that's what we're concerned about. If you follow the regulations, follow the science, do your due diligence, we believe that we will not be an anomaly, that there are going to be school districts all over the state essentially paralyzed in terms of their capacity to educate their entire student population.
Just so I can summarize your answer real quick. So you were doing temperature checks when students were walking into your facilities? You
We
weren't?
we do not have the capacity to do that because of this short period of time that we run 40 buses, and those buses travel some 2,500 miles twice a day. And so those students, many of them are moving in and out of the building very rapidly. Anytime we have a report from a teacher that a student appears to have a problem, then yes, we immediately put them in a full screening protocol.
Gotcha. Follow up.
Yes, you're recognized.
How many of your students are currently hospitalized with COVID?
I'm not aware of any, but that does not mean that it could not have happened today. And again, the hospitalization and the potential medical effects on that particular child are something that is going to be controlled by a number of variables. The thing that we believe to be the most disconcerting at the moment is the number of students that we will all across the state be forced to quarantine and who will be missing important educational opportunities that we could fix simply with a local opportunity to implement a mask.
Thank you.
If I could just add something to what the superintendent was saying. Temperature checks alone are actually really low yield for screening for COVID, just because not everybody who's positive for COVID will have an actual fever. So I don't think that the superintendent's efforts should be discounted because they weren't doing temperature checks.
I'd like to drill down a little more on what Representative Pilkington was asking. Can you hear me all right? Okay. We know you gave us the number quarantined, but how long is the quarantine? How long do you put them in quarantine?
The quarantine is usually 14 days. It can mean as many as 10 days out of school. And there are ways that the quarantine can be shortened if the student can avail themselves to a testing opportunity and prove that they are negative after an appropriate period of time. But that puts a big burden on the places that do the testing, and for our students, most of whom are living in some various conditions of poverty, accessing those healthcare opportunities in the testing sites is something of a challenge.
Dr. Thompson, I think the CDC guidelines is lower than 14 days. Is that correct?
They allow release from quarantine, I believe, after 7 days if you have a negative test.
Yeah. And I think Representative Pilkington asked this question. I didn't hear the answer. How many of the students are hospitalized?
I'm not aware of any at the moment, but that, again, it could have happened today and I not be aware of it. I've been here all day. But again, the hospitalization is not the only issue. The issue is how many students are missing school simply because we do not have the capacity to.
Would you please stick to my questions? We got a lot of people lined up.
I thought I was.
Well, my question was how many's hospitalized? And you said none.
Okay.
So how many active cases do you have?
When we left this morning, it was 739, I believe, and it.
You have
730 this morning, and it has gone up since then.
Positive cases?
No, excuse me. Positive cases, we have, when I left this morning, it was 43.
Okay. So these positive cases, did that all happen on one day, or was that
No, sir. No,
over a period of time?
It has happened, and it is increasing in frequency, and hopefully it has gone down today, but our highest so far in any one day has been 18.
Did you consider, or do you think it might be a good action to maybe close the school for a period of 7 days?
It's not just one school, it would be the entire district, because those cases are not isolated to one school. But yes, we have had a conversation with the liaison at the Department of Education who continues to monitor our situation very closely. And as I'm sure you know, their answer relates back to is your case load within the school district rising faster than it is in the community or vice versa? And at the moment, their answer has been continue to gather more data so that they can make an educated decision. But it's certainly closing a school after the year we had last year is certainly an option we'd like to avoid.
All right, thank you for your answers. Representative Pilkington, did you have another question, or did you just have?
I'll go back in the queue. I'll let my fellow colleagues ask their questions, but I'd like to be put back.
Okay, you'll need to ring back in then.
Okay.
Representative Dodson, you're recognized for a question.
Thank you, Mr. Chair. To your left here. Last year, I'm assuming you had a mask mandate across your entire school district?
Yes, sir.
Was that for all grade levels, or were, I think, 10 and under, or was it K through 4?
No, it was for all grade levels.
It was for all grade levels?
Yes, sir.
And did you have any outbreaks whatsoever last year?
We did, but certainly not to the extent that we're experiencing in this cycle.
Okay. And how did students handle the compliance with masking last year?
Actually, students, on the most part, are fine with it. We're like everybody else, had parents who had concerns, but students, for the most part, they monitor and adjust to their conditions, and when everyone's wearing one, then it is something that becomes a very comfortable situation for the vast majority of those involved.
And your staff?
Same. And I think if you poll any staff in the conditions that we're operating in at the moment, they're going to tell you they would be extremely comfortable if they were all masked.
Thank you.
Representative Bentley, you're recognized.
Thank you. Quick question on that. Last year we had mask mandates in place for school when school started. But even though we had mask mandates in place, I guess I'm directing this to Julie or the position there, we still saw a huge spike in cases. So even though we had a mask mandate for everyone, cases still continue to rise. In fact, they spiked in December, even though we were masking from the time of September. So I'm not sure that masking at this point is going to be the thing to affect the cases. So to the physician over there, do you know, are you guys early treating these folks when they first get diagnosed? Are we doing any treatments for these kids when they're diagnosed at all? Or are we waiting until they get really sick?
So there's no proven treatments for people who are not hypoxemic from COVID. There's no evidence that there's anything that will help them, so it's supportive care. The moment that a child is hypoxemic and requiring oxygen, the treatment is dexamethasone, plus minus maybe remdesivir. If the child acutely decompensates, you can consider tocilizumab. Also, Lovenox is used to help. COVID can cause a prothrombotic state in that acute phase, so Lovenox, which is a blood thinner, is used to help prevent against that. But as far as in the early stages when children are first diagnosed and they're not requiring oxygen and it's just Tylenol and Motrin, lots of fluids, and lots of supportive care.
Follow-up, Chairman. I would greatly disagree with that statement. I think there are physicians across the nation and around the world that are seeing great effects with ivermectin, hydroxychloroquine, and other things that they're using beforehand to stop. So I'm really, again, very concerned that we're not doing any early treatment across the state. There are proven methods, and I would suggest that you do some more research on that, because there are proven methods that physicians around the nation are seeing an 85% decrease in any hospitalizations. So to not do any treatment when we can do an 85% decrease in hospitalizations on COVID patients is very concerning to me. So I would suggest that you would just do some more research on things. The FDA has not approved all of them, but neither have they approved the vaccinations at all. It's not been approved. So I would highly recommend it. I'm really concerned with that statement. But we have seen, I know that your other comment, this is to the physician there, your other comment was that you haven't seen any hospitalizations from children wearing masks. But there have been numerous things that have happened to children. Some parents took their masks and had them studied by the University of Florida. And on those masks that were studied by students, because we know kids are kids, right? They're not going to, it's not a sterile environment like you have in the hospital or in a healthcare facility. Kids are kids. They're going to drop them on the floor. They're going to go to the bathroom. They're not going to wash their hands. And so these are the things I want you to hear that were on this mask. And to me, I want to ask you if this would concern you, if you knew that this was on the mask of children, young children. We're talking about children under the age of 12 wearing these masks. There was pneumonia, tuberculosis, meningitis, encephalitis, pneumonia, bloodstream infections, meningitis, UTI, resistant to antibiotics, E. coli, Lyme disease, and to me as a nurse that worked at Children's Hospital, the most concerning was staphylococcal meningitis that was found on the mask. So these are things that parents are reading, and these are things that parents are concerned about. So could you understand why a parent might be concerned if they read those studies and those were on the mask, why parents think that might be their best choice on whether their child should wear a mask? A young child under the age of 12 that does not know how to wear a mask correctly or is not going to, do you think it would be concerning for them to hear that report?
So I can say that, yes, I've had parents who have been concerned about masks and have shared those things with me. And we have talked through that evidence and we have talked through those things, and we are not seeing children being admitted, certainly not with staphylococcal meningitis or urinary tract infections from wearing a mask. So what we are seeing is children being admitted with COVID. And that what has been proven is that masks do stop that spread of COVID. And I'm happy to talk with you later about these studies and kind of go through them and everything. But honestly, we're seeing children in the hospital because of COVID, not from these other things.
One last follow-up, Chairman. I would disagree in saying that.
I'll give you one more follow-up.
Last one follow-up. So again, I appreciate we all need to work on this together, and we're concerned about this for sure. But again, when we were having mask mandates in Arkansas and everyone was wearing, we're still seeing a spike and increase in cases. So I guess we're going to agree to disagree, and I'll work on this together. So thank you, Chairman.
Okay, I see that we've had some non-members of the committee that have rung in here to ask questions. As y'all know, we're breaking new ground here. So we're kind of, trying to learn as we go along. So I have consulted with the chamber and with the parliamentarian. And since we're in a regular committee and not a joint committee, I cannot take questions from non-members. So going forward, that'll be the rule. So Representative Allen, you're recognized.
Thank you, Mr. Chairman. And this question is for the school superintendent. I appreciate you being here today, Mr. Superintendent. I was wondering if you had received any guidelines from the Department of Education prior to your school starting.
We continue to receive guidelines from the department on almost a daily basis, year-round, on a variety of topics. I'm certain some of those related back to continued adherence to the directions that we had been given in the past in terms of protocols for our students.
Okay. One follow-up?
Yes, you can have follow-up.
Very short. This question is for the epidemiologist or the infection control person. I like sports. And whenever there's a boxing match, the referee gives instructions. And one of the instructions that the referee will tell the boxers, he'll call them to the center of the ring, and he'll say, protect yourself at all times. Would you agree that we need to try to protect ourselves at all times from this virus? Because this is an invisible enemy, and we don't know whether the enemy is going, when the enemy is going to strike, or if the enemy is going to strike. So would you agree?
So I would advocate highly that everybody who's eligible to be vaccinated get vaccinated. That is one method of protection. Everyone else, and even people who are vaccinated, there's increasing data that shows that we, in high transmission areas, we all may need to be masking. That I would say that for everyone to protect themselves and to protect our children, that we should allow masks. Yes.
Thank you.
Dr. Fender, I had another question for you, and I appreciate you coming and presenting what's happening at Marion. It's very helpful to us. But I did have one other question, and you maybe don't have this information, but do you have a breakdown on age, the people that are active cases and quarantined? Do you have any kind of a breakdown on age, like elementary down or elementary up?
I don't have an exact number, but when we looked Friday and we're examining, again, we're trying to compile this data on a weekly basis so there's not false positives but about a third of our quarantine came from students who were in elementary school. The vast majority of our quarantines came from basically our junior and high school students who are more active and more social and, are maybe not monitored, their activities are maybe not monitored as closely as our elementary students are, particularly out of school.
So I'm curious, so you saw more in the junior high than the high school? Is that?
Yes, but that was for a 1 week period. We may get a different result this week. Again, we continue to provide the data to the Department of Education, who continues to look at our numbers school by school, even grade by grade. And then we are allowing them to analyze their concerns about where the most cases are coming from. But the overarching concern for us, again, Mr. Chairman, is just that we have 700 students out of school for an extended period of time that would have still been in school if we had had the opportunity to have them masked. And that's as far as our science goes. We just know if there's something that'll help us keep our kids in school, that's a good thing.
So within your system where you had multiple campuses, did that help you in the isolation or did the buses cross? Are you following what I'm asking? Did it help you in the quarantine?
I've already screwed up one question. I don't want to screw up another one.
No, I'm just curious, did it help you isolate it on different campuses or all your campuses together?
No, sir, they are not.
Okay, so you have separate campuses, separate bus systems. So did that help you in containing this at all?
It helped us to identify where the cases were coming from, but it doesn't necessarily, until you reach a point where the data, there's sufficient data to reach a scientific conclusion, you really are still more or less flying blind, but the data we are collecting is being analyzed by scientists in a very clinical manner, and as soon as they tell us there is something significant there, we're going to take immediate action.
All right.
But that action is still very limited.
Thank you for that. Members, if you would, hold down your discussions and please go outside if you need to talk to one another. Representative Pilkington, you're recognized for a question.
Thank you, Mr. Chairman. I appreciate you being here, and I'm sorry, Superintendent, if my questions seem so picking. I'm just trying to get an understanding of the situation on the ground. Do you at all know the vaccination rates of your faculty and the vaccination rates of your students over 12 who are eligible for the vaccine?
Our vaccination rates for our faculty, I think, are, when we last checked, were somewhere in the 75% range. Our student vaccination rates are changing daily. Again, we had a shot clinic today, and there will be a number of our students who were there. Gathering that data is a little more laborious process, and it's something that we certainly are going to have. I just can't give you a specific number. We've been busy dealing with chasing students and trying to figure out quarantining protocols in an effort to try to slow the process down. But I can assure you we're advertising, doing everything we can to encourage our students to vaccinate. And I really don't imagine that our student vaccination rate is significantly different than anyone else's in the state.
Okay, thank you. I've got a quick follow-up as well.
Yes, you recognize.
And this can be answered by you or the pediatrician. I'm sorry, I didn't catch your name. Do you think that it would be more advantageous for us to prevent outbreaks if we delayed school until after Labor Day? The infection rate that we're seeing right now with the Delta variant is so great that some believe that it will spike in the next 4 to 5 weeks, and that we'll be on the other end. Do you think it would be better for us to postpone school until after Labor Day so that we would get a better outcome and that we wouldn't overburden our healthcare facilities? And either one.
So that's a bit of a hard question because we don't really know what's going to happen after Labor Day. I mean, if the cases keep going and keep going and keep going, and we don't ever plateau or start to decrease, then there will never be a good time to open school. So all things considered, the other thing is that kids need to be in school. I mean, there are so many resources that are provided to them. I mean, what I would hope is that, you know, all the adults in Arkansas would be invested in the outcomes of their children and would take all steps necessary to make it to where school would be safe, and that we could do that as soon as possible. I don't have a crystal ball, and I can't tell you what's going to happen between now and Labor Day, if things are going to calm down by Labor Day or if they're just going to keep getting worse. So I'm hesitant to just give you an absolute like that.
Representative Gonzalez, you're recognized for a question.
Thank you, Mr. Chair. I have a couple, probably pretty quick ones if you allow. First one to the superintendent. Have you had any, I'm right here in front of you.
Excuse me. Oh, I'm sorry.
That's all right. Yeah, I understand how confusing it is when
I'm
sound's
old, I
coming
can't
from
hear.
everywhere. Yeah. Have you had any communication from the Department of Education on mask mandates in the schools? Any written communication from?
On what, sir?
On mask mandates in schools?
Across the country or no?
The Arkansas Department of Education.
Has the Arkansas Department communicated with us about mask mandates? No.
Okay. All right.
No, we have been doing some research anecdotally in terms of what other states are doing, and you know, obviously, as you well know, it's a mixed bag.
Mm-hmm. Okay. Follow up, Mr. Chair.
Yes, you're recognized.
Thank you. So your school district's in Marion?
Yes, sir.
Is that correct? Okay. I didn't know exactly where that was, so I tried to look it up on the Google
It's a
Maps
garden spot of the state.
and compare it. I was trying to compare it to this map that we've got here, and I don't know if you have that.
But just saw it earlier.
It looks like everything around that area does not fall into that group of 50 or more per 10,000.
Mm-hmm.
Is that your understanding, that this would not even apply to your district at this time?
It's my understanding that at the moment, we might not qualify. I have no concern that we would be qualifying very quickly. I think the scary part is interpreting that data. If we don't qualify, and yet we're having already 700 to 800 quarantines in our school district, then think what happens when we do eventually meet those benchmarks. How many kids will we have had to have quarantined prior to reaching that total? So I do believe that if we're not there yet, we have to be right on the razor's edge.
I'd like for Dr. Thompson to address that because, you know, in putting this together, you know the process. I was trying to narrow it down to what makes sense, and so those hot red zones kind of made sense. But that's not what the CDC says. The CDC would back it up a little bit, but I'll let him explain that a little bit more. So again, I want to point out, if there are changes to this, you know I'm open to adjusting to what needs to be done. So Dr. Thompson.
So the thresholds that we selected last year were from the Minnesota Public Health Policy, or Minnesota Public Health model, not the CDC model, because Minnesota looked more like Arkansas than New York State. They have a central urban area and they have a lot of rural areas. And so they had this green, yellow, orange, red, and we adopted that last year. The CDC threshold for high contagion is at the transition point from green to yellow. That's where the CDC would say take action. Representative Mayberry's bill is at the orange to red. When we release data tomorrow, I believe Marion will be orange. So in picking the threshold, ideally, you would want to pick the threshold before a school was in trouble. But I think it's predictable that any school that's in red will be in trouble very quickly, and I do agree with the superintendent, Marion. They were green the last 2 weeks of July. They were orange, going to be orange tomorrow. They'll be red the next week.
Okay. Yeah, I mean, I understand that, things progress, but my point being that right now, this would have absolutely zero effect on your school district and your current situation.
But we can wait. We've learned to be patient.
Could I have one more follow-up, Mr.?
One more.
All right, thank you. So you had mentioned that you would be open to some type of amendments, and I think one of the things that drove people crazy about the mask mandates previously were the inconsistencies in them. Students had to wear them in a classroom. Football players could get on a football field and tackle each other and slobber all over each other and not have a mask on until they had to go back to the sideline. Then they had the 6-foot distance. Cheerleaders had the 6-foot distance on the sideline and wear masks. They couldn't get close to each other. Band members could actually cut holes in their masks so they could blow their instruments. So if we have something like this, I mean, right, that sounds crazy, right? So if we have something like this, and if we're in such a bad pandemic that we have to mandate masks for these kids, would you support an amendment that would just shut off all extracurricular activities at that point?
Well, now you are trying to get me fired. I totally agree with you, Representative. There were some decisions that were made by groups that were hard to understand, hard to defend. And some I did not agree with. Extracurricular activities are hugely important in the lives of our students, just as they are in any others, but I think particularly for students living in poverty, they're a lifeline. But I think the statement that you made is essentially accurate. There were a lot of things that were a little goofy, but we still believe that they worked and that they helped. And at this point, I would be willing to discuss anything that would give us the option to have the local choice of putting masks on our students, at least until we get past this new surge, which I believe is much more dangerous than anything we've encountered to this date.
You're done. Vice Chair Ferguson, you're recognized for a question.
Yes, can you, compared to last year in a similar surge when you could have mask mandates, how many people were you quarantining then?
Maybe at the height, not exactly, somewhere between. The worst days we probably had were 200 to 300, and those were very, very isolated instances. The difference between last year and this year is simply that last year we were dealing primarily with older students and adults. And those older students and adults were easier to convince and to monitor and to maintain in terms of the overall protocols for safety. When you start dealing with young students, you want to make certain that you are mandating, providing every imaginable service possible to keep them safe. And again, my concern is that these numbers are numbers that are extraordinarily high. The rest of the state has not experienced what we're going through yet. I do not believe we are prepared as a state or a medical community to deal with the consequences of what will happen if we continue to move forward in this manner. And for us, our big concern is just the level of contagiousness that has been elevated because of this new variant and the fact that we're dealing with younger children.
And I guess a follow-up. So, I mean, say a kid had mumps, would you do a similar quarantine with that child?
Absolutely. We'd follow whatever medical protocol is outlined. You know, we're simply asking for a premise that I think is a solid bedrock of any conservative mentality, and that is give us as much choice as we can to do what we need to do locally.
Thank you.
Representative Wing, you're recognized for a question.
Thank you, Mr. Chair. Just a couple of quick questions. Of the 43 positive tests that you had, or that you currently have, how many of those are siblings or neighbors?
I don't have that answer. I can make one up if you would like, but I'll be glad to provide that for you.
Okay.
I just don't have that information. I'm going to tell you that I don't believe there will be very many, but there could be some.
Thank you. And then so as we look at the 700 plus that have been quarantined, were they quarantined with a 6-foot rule or a 3-foot rule?
They were quarantined by whatever is the latest direction from the Department of Education. I can assure you our team is very, very thorough. And as a matter of fact, our head of our school nurse is Miss Kelly Fogelman, and she was just named Arkansas School Nurse of the Year. And she earned that reputation, I can assure you. If I'm ever incapacitated, I want her by my bedside as long as she doesn't have a weapon.
Of those who have been quarantined, that's a good endorsement right there.
Yeah.
Of those who have been quarantined, how many of those have tested positive?
The numbers that I gave you were the positives of, I'm terrible with numbers.
I know we've got 43 total, but was there any of the 700 that have been quarantined because of exposure to those 43? How many of those have tested positive?
I can't give you that number, but the theory being the faster we got them away from those who had tested positive, the better off they're going to be. And they will obviously go through a number of protocols before they're allowed back in the population.
All right. Thank you very much. Appreciate it.
Thank you, sir.
Representative Miller, you're recognized for a question.
Thank you, Mr. Chair. I guess just to kind of cut down to it here, the reason that we're here having this discussion period is because people aren't voluntarily wearing masks enough. I think we could all agree on that. And I'm not going to argue whether it is or it isn't, but if the situation's so desperate in all of our communities, why are people not volunteering to wear a mask and do what, according to these studies or testimony that we're hearing, do what is necessary to stop the spread? Is there an answer as to why that's not happening?
I just want to say that in medicine, there are lots of times we ask people to do the right thing by themselves. We ask people to eat right. We ask people to exercise. We ask people not to look at their phones before they go to bed. And people are just human and they just don't do it. And I don't, it is hard for me. I hate it. And I wish that there was, if we could give every positive incentive in the world, by all means, I would say do it. Do whatever it takes to get people to wear more masks. Do whatever it takes to get people vaccinated. But as far as why aren't people wearing masks, well, people are human.
We have a follow-up, Mr. Chair.
Yes, go ahead.
Thank you. You're right. I completely agree. We're all human, and masks aren't going to stop us from being human. So my next question is this. To preface it, I'm a product of my district. I'm a product of the people who've hired me that I work for. And I will never, I guess my question is, are we smarter than the people that we work for, than the humans that are being human by wearing or not wearing their masks. Are we in this room, whether it's y'all testifying or us sitting here making these decisions, are we smarter than the people we work for? Go.
I don't quite understand the question, but just a general statement that what this bill allows is for your district, the schools, the school board in your district to make that determination. And if they decide that they don't want to require the mask, then that's what takes place in your school district. But let's say Representative Allen's has some school districts that would fall in this, then that school board can make the determination there. And I believe that that's how our law should be made, to allow the flexibility so that the people, so that one does not cover all. And we're trying to give flexibility, and I think that's the goal here.
Well, we have the flexibility if we're under or around this threshold, correct?
Say that again, because I'm not quite sure.
I'm just making sure that I'm understanding the bill correctly. We have, if this bill were to pass, there would be flexibility for our school districts if they're under this threshold of whatever.
If they meet that threshold, they would have the option to make that decision. If they're under that threshold, they don't even have the option to make that decision. And again, we can change that threshold. I'm not so sold on what it is. I mean, we're hearing Marion and the experience there. Maybe we need it to be 7 days instead of 14 days so we can react quicker. I'm willing to discuss whatever options there are. But I believe in giving local control because I don't know what your district looks like. My district is our school district covers 2 different counties. And there might be a high infection rate in a different part of Saline County and a very small infection rate in my portion of Saline County, which is included with the Sheridan School District. And I want my school board to be able to look at the boundaries within that school district. What is the situation there? And make decisions based on parent feedback, faculty feedback, doctors in the area, other medical professionals, getting information from the Department of Health, getting information from the Department of Education, and making that as local of a decision as possible. I don't want to take away any tool from someone to help protect kids. That's all I'm trying to do is give them one other tool. This is a tool that we're saying they can't use.
I understand. Thank you, Representative Mayberry. Thank you, Mr. Chair.
Representative Allen, you're recognized.
Thank you. As you know, the virus has had an adverse impact on our economy, our academic, housing, and mental health, as well as our lifestyles. Our healthcare system has been stressed to its capacity. In the state of Arkansas, we had over 392,000 cases, 6,215 deaths. In the U.S., we had 35.3 million diagnoses, over 614,000 deaths. At what point will it be too late to prevent mass COVID infections and deaths?
That's a really good question, and I don't know if I know the answer to it, and I see Dr. Thompson is conveniently also walked away. I don't know when it's too late, but I can tell you that never is probably too late.
Thank you.
Representative Gonzalez, you're recognized for a question.
Thank you, Mr. Chair. Just to follow up from my previous, I think I got a very political answer. I mean, you might make a good politician one day. But on that, so I mean, would any of y'all, all of you, would you support that amendment to shut down extracurricular activities if the pandemic got to the point where we have to require masks in the classrooms? And I completely understand that extracurricular activities are important. They're an important part of learning, but I wouldn't say that they're as important as maybe students reading or grade level. I don't know where your school stands on that percentage. But.
Not unlike the sponsor of the bill, I think this is a negotiating process. I'm not telling you that we're not willing to put anything on the table to provide for the safety of our students. There are already processes in place to eliminate extracurricular activities when the appropriate level of activity in terms of the virus is detected. But certainly, if there needs to be another look at that, while I'm confident it would be almost as unpopular as my being here today, that's certainly something I'm open to anything. I've got 700 and some odd kids not in school today, and that makes me sick. And the number's going to go up, and I've got some young students who I can't look their parents in the eye and tell them I'm doing everything that we believe scientifically possible to take care of their kids, and that makes me sicker. So I'm simply trying to explain that whether you solve this now or you wait, I think Arkansas is headed to a very difficult place if this particular mandate stays in force. I think it's going to be one that we will all look back on and say, we would not have made that decision had you had the information that's available to you today. And that's human nature. I'm not upset or blaming anybody. I'm just asking folks to step back and look at it with where we are today.
I'd also like to kind of address that. The way that the call was written is very specific on this one issue. And I think that the amendment that you are asking me to add in there, although I'm open to the ideas, I don't know if I can have that in there based on the call, because this morning I was planning on filing other pieces to this and had to take it off because the call was very narrowly worded. So I don't know how far outside of that bounds. I'd like to give our school districts as many tools as they can. But I don't know if we can do that during this session, and maybe that's the discussion that we need to have too. I'm not the legal expert on this. That would take, talking to others who know more. But I'd like to give our school districts as many tools as possible.
Jeff, follow up. Here, let me put you back in.
I guess more of just a response, if you will. I mean, we can do whatever we want with 2/3 vote, House and Senate. We can add whatever amendments we feel like are necessary, even outside of the call. So. Wouldn't you agree?
Will you help me convince 2/3 of the members to be in support of working on this?
Representative Bentley, you're recognized for a question.
Thank you, Chairman. I'm going to apologize to the position here because this question is to you, and I really wrote it for Dr. Thompson, but he left. So I'm going to ask you if you can maybe help me with this question. We're all very concerned about COVID in our state, and I don't want you to think that we're not, because we definitely are. My question is, looking at the recent breakthroughs that we've seen in vaccinated individuals in Israel at 84%, and in Massachusetts, and that recent breakout, people that got the COVID were 75% of them were vaccinated. So do you think that allowing students to develop a natural immunity is the safest thing that we could do for them at this point? Because we've gone from the Alpha variant to the Delta variant, which is more, to me, I would appreciate your opinion on that. It might have been better if we hadn't had masked the kids last year and they had developed some natural immunities. We wouldn't be here today with so many cases. So that's my concern. I would really like your thoughts on that, because we know that children are getting they're not near as sick when they get it as adults are, and letting them develop some natural immunities might be the best thing in the long run for our students, because it's not going anywhere. COVID's here for a while. So I would really like your thoughts on that. Thank you.
So the breakthrough cases with people who have been vaccinated, those people are not ending up in the hospital, unlike the unvaccinated group. There's also data that shows that if somebody has, if you compare natural immunity to the vaccine immunity, so when you get the virus itself, you're seeing lots of different things to make antibodies against, including the spike protein, which is like the major gateway in. But you're not, when you get the vaccine, you just get the spike protein, and that's what your immune system is trained to. So it's almost like you've been given a cheat sheet for like an English literature test, and you're like, here's all the answers to all the questions on Shakespeare. Instead of somebody just throwing, here's all of Shakespeare's works, you know, and you have to read through it. Instead, somebody's giving you that cheat sheet, and you know what to do, and the immunity from the vaccine seems to be stronger than natural immunity. So, and we also have the ability to use the vaccines. You know, they're working on potentially doing boosters, potentially doing a booster specific for the Delta variant, which would be even stronger. So, no, I do not think that natural infection is better. I think that vaccination, for the children that it is eligible for, that is better.
Representative Dodson, you're recognized for a question.
Thank you, Mr. Chair. So I've heard you, it's been brought up, and I can't remember who all brought it up, but it's been brought up, I think, a couple of times regarding local control, giving the district back the ability to make that local decision, because the local decision that you make, you know better than we do what your local situation is. I mean, I would submit to you that a parent knows better what their local situation is than even the school board does for their child. They're the ones that are closest to their child and know their child's situation better than a government entity. So the most local control is the family and is a parent. I guess if we were to give you that local control of being able to mandate masks within your district, would you be supportive of allowing a parent to pull their child from your district and the dollars to follow that child so that they could have education for their child that is best for their child?
I think there are already laws in place that allows parents and students to move from one district to the next based on their what they feel is an appropriate place for their educational experience. And again, I'm not representing any group, but if you told me that that's the choice that was required to be made for us to be able to mandate masks in our school district and know that we're taking care of our students in the best way possible, and someone wanted to move their students because of that choice, that's a small price to pay.
Okay. I think there's an alternative bill that's been filed in the Senate to that effect, so I look forward to hearing the debate on that when that comes up. Follow-up, Mr. Chair?
Yes, you're recognized.
I don't know, and this may be a question of somebody stand up or who's signed up later to speak, but is the School Board Association or Superintendent Association here to testify in support of this bill? What's their position on this? Did they ask for it?
Oh, I have shared this with them. They are aware of it, but I'm not going to speak on their behalf. I don't know if they're here. Yes, they are here, and I would much prefer them to come and talk to you. I'm not going to at all put words in their mouth.
Hopefully we can hear from them soon. Thank you.
Representative Pilkington, you're recognized.
Thank you, Mr. Chairman. So I think Representative Mayberry didn't say this guy correct. She said that we banned the tool, which we didn't ban the tool. We banned the mask mandate. So you can still wear a mask if you want to at school. And, you know, in talking with my superintendent, you know, one of the things we talked about was just encouraging people to wear them if they're concerned about it. And so in Mariana, I'm curious, when you had your first case, did you at any time say, listen, we can't do a mandate, but for the love of God, please put on a mask so that we don't have to send more kids home? Did that ever occur, or was it just, hey?
It never stopped.
So you had people wearing masks at the school?
No, we began immediately prior to even the start of school to encourage our teachers to understand the importance of wearing masks themselves and encouraging their students to wear those masks.
And what was the compliance rate of that?
For the faculty and staff, it's pretty high. For the students, it's what you would expect. It's hit or miss depending on the class that they're in, their activity. It's certainly not something that's going to add to the efficacy of the safety that we're trying to instill. I guess wearing a mask for any time is better than not wearing a mask at all. But again, when you have a fully masked classroom, you have the maximum level of safety that you can achieve. If you have one student in there, two students who aren't masked, that compromises the integrity of the entire model in terms of the science. So we're simply trying to do everything we can to create as safe an environment as possible for our students. And it would be done in conjunction with, in communication with our parents, and certainly in a way that I think our school board would very diligently assess the entire circumstance before making a decision.
Okay, so just so I'm correct on here, you, even before school started, and the mask mandate bill went into effect, which I believe was July 27th, you were saying, listen, we still want you to wear a mask even though we can't mandate it, and you had some compliance but issues with students being compliant, correct?
Yes.
Okay, thank you.
Can I just also share a thought sort of along this lines? And I understand right now a teacher cannot smoke in the classroom. Why do we tell a teacher that her personal choice of smoking cannot be done in that classroom? And the reason for that is because when she blows out or he blows out, it could potentially cause some harm to the students in the room. Now, we don't know how long it's going to take for that harm to occur. We don't even know for sure that harm is going to occur to that child, that they're going to get cancer from it. But I think we're all in agreement that we don't want our teachers smoking in the classroom. So that teacher's personal freedom ended where that child's right to breathe the fresh air ended. I think we need to put the kids first in this situation and consider that as well.
Representative Cloud, you recognize for a question.
Thank you, Mr. Chairman. Dr. Young, I'm going to ask you for your opinion. We've heard several times here today, Representative Mayberry just said, we want to do what's best for the child. We want to do the very best. If you look around the room, there's several different types of masks. And part of my concern is if we're not going to be disingenuous about this and say that we're going to do the best, and I know that you can argue that any mask will be better than no mask. I don't dispute that argument. But if this body says it's okay to mandate masks, then why shouldn't we mandate N95s that are properly fitted, that we know are going to protect not only the other students, as Dr. Finner referred to, but it's going to protect that individual student. And so that's what I'm wondering is not all masks are created equal. So.
Correct. Not all masks are created equal. N95s that have been fit tested are by far the best. I have no idea how you would logistically pull off fit testing and acquiring enough N95s that fit different kids of different ages and different sizes. If I could have my cake and eat it too, by all means, let's get an N95 for every kid. I don't know if we can physically possibly do that.
Follow up, please.
Yeah, you're recognized.
Okay, so maybe that's kind of improbable, but we agree that it would be best, I think, from a medical point of view. So Dr. Fenner's not been able to take temperatures, whether or not that's going to be an end-all to all. I don't think it would be, but if we use everything in the armamentarium to help prevent the spread, we're going to be better than saying, well, if you want to send your kid to school, he's going to have to wear a mask, but we're not going to define what a mask is. Again, I think we're being disingenuous. Thank you.
All right. Seeing no more questions from the committee, we do have 6 people signed up to speak against the bill and 1 to speak for the bill. And legislators that are not members of this committee, when I said earlier you couldn't ask questions, you do have the right to sign up in the back to speak for or against the bill if you choose to do that. So we will thank you all very much for your discussion, your comments. So we'll start with someone to speak. Is this for the bill? Okay. To speak against the bill, Dallas Green, you would come forward. And introduce yourself and who you represent. And you are speaking against the bill. Okay. Please introduce yourself.
I'm Dallas Green. I'm just a mom today.
Yeah, if you would move closer to the mic so we can hear you very well.
Yeah, I'm not really representing anyone today other than my children.
Okay. You're recognized.
First of all, I would like to say that I follow the same research that Representative Mary Bentley must follow because I agree with her 100%. We've had COVID in my family and we used ivermectin and HCQ. And I know that that goes against the echo chamber that's been going on around here, but it works. So for me to sit here for an hour and listen to how people are sending their children at home just to suffer when there is medication that does work, I find that to be criminal and neglectful. I am against the mask. I'm sure that doesn't surprise any of y'all. You can't tell me that the study that the parents did in Florida when they sent their children's masks to a lab isn't correct. If anybody has paid attention to a gym floor carpet, there's all kinds of MRSA and all kinds of stuff that grows on that. Same thing with the mask. Kids aren't going to be sanitary with a mask. A cloth mask, their favorite mask, the one that doesn't bother their ears, the one that they have to have every day, that's not going to get washed like it should. It's not sanitary. So for someone to sit up here and say that there's not MRSA on it or some sort of bacteria that cause bacterial pneumonia is incorrect. And to say that they only have COVID patients in Children's Hospital is insane. We have just sat here and listened from other people about how RSV is going around. Well, take the mask off the kids, and I bet they don't have RSV in the summertime. I am a nurse, by the way. This risk versus benefit, what about the gain of function? Do any of y'all know about the gain of function? Everybody is uncomfortable. Y'all may be uncomfortable in here, but you're asking children 12 to 4 to be uncomfortable a lot for 8 hours a day. But then it's okay for wrestlers and football players to spit and drink after each other and roll around on top of each other without a mask. That doesn't make any sense. There's no consistency. Okay, so you can't play sports. Football's so important. Well, in this state, we have rearranged our literacy curriculum. And part of that curriculum, there is a sound wall in elementary classes, kindergarten through 2nd grade in most of them. If they're following the literacy law, they're having a sound wall. The sound wall is a picture of an adult mouth right here. That's all you see. And it's the adult making the sound. That's part of their reading curriculum. Now, if I'm masked up and the kids are masked up, nobody can see that. So it does impede academics. And as far as leaving something up to a school board, as a literacy advocate, I find that a joke because I have traveled this whole state for over 6 years, going into schools, fighting for kids to get what they need because the school board system didn't work. Doesn't work to the point that we've had to pass literacy laws, countless literacy laws, because the school board system doesn't work for parents. First of all, if you have a complaint, you have to submit what your complaint is to many school boards. You can't just go to the school board meeting and talk. You have to submit the complaint. And then if they feel like that complaint is valid enough, then they'll let you speak. And then at some school boards around the state, they will not even respond back. They send you a letter. This is not letting the individual decide. And for Republicans to run this bill, it goes against the party platform. The ultimate minority is the individual. Y'all are treading on me. I don't agree with just getting a COVID diagnosis and going home until they decide to throw you on a vent so they can make more money. Yes, the hospitals are overwhelmed, but you have all these nurses that don't want to get the shot. I don't blame them. You have boys, there's all kinds of research about how boys who get the shot, then they have myocarditis or pericarditis. Well, that's heart disease. We want children to have heart disease over something that they're have a 98%, 99% chance of surviving? Pathetic. You know, they're not even doing temperature checks. He's so worried about it, but they're not even doing temperature checks? You would think that there would be some kind of, if they can't monitor that, then they're not going to be able to monitor masks. Who's wearing them? Who's not going to wear them, who's got an exemption, that's another person's job. And nurses, school nurses, they already have enough. You already have them sending home BMI reports, doing insulin and all sorts of things. And as a literacy advocate, I have watched Julie Mayberry for the past 6 or 7 years go into education committees and beg for laws because her school board system didn't work for her. That's not the answer. It's up to the parent. So are we going to let the schools are they going to be in charge when the science keeps changing and eventually the science is going to say the mask didn't work? So are all the schools going to be liable for everything that happened to some of these children, including organ failure because they couldn't breathe? That's all I have to say. It's just my opinion, and my opinion does matter.
Thank you for your comments. Okay, to speak for the bill, Mike Hernandez. I hope I pronounced that correctly. Hernandez. Please introduce yourself for the record and who you represent.
Sir, thank you, Chairman. Mike Hernandez, Executive Director for the Arkansas Association of Educational Administrators. And, we're here to speak in support of this bill. And I caveat to say that just like, many of you in your communities, there is not wide consensus on what is the right approach to take with this, this pandemic. And so, we were very appreciative of Representative Mayberry reaching out to us and sending some of her language and taking some comments back from us so we could share with our members to see what their opinion was about this bill. We did so this morning and seemed to have an overwhelming response that there was support for this type of bill. Obviously, there are some that do not feel like this is an appropriate path and would much rather see a mandate, come from a higher level potentially. And kind of the dilemma with that is that, we're educators. I still have faith in what our Department of Health says, what our local physicians tell us is that this is a very serious pandemic, and the advice that we're getting locally is that masks are important. But when we look everywhere, that's not, as the surge has come back up, that's not something that's widely utilized in all areas of our community. And so it leaves us with that spot of saying, what is that middle ground? What's the right approach to take with this? And so, Representative Mayberry said at the beginning that this was not a bill that everybody liked, so she felt like she was on to something. And so I think what we're asking for is that, this bill definitely be considered, if there are modifications that might be made to make it better to be able to keep our kids safe. I think that's kind of the bottom line that we're looking for is can we listen to our health experts and make a wise decision and what's the best approach, and knowing that we really want to keep our kids in school without, delaying days and those types of things. And, Superintendent Glenn Fenner alluded to a lot of the things that they're going through in their district, and we know that that's going to be probably something to come if cases continue to move in this direction. And so I think our plead for this body is to, consider this bill as well as any modifications that may make it a little bit more palatable. But we need help and support. Leaving it back to the local board to make the decision without any kind of guardrails is something that we would have some concerns about. But we feel like with this body, with our health experts in our districts, we can find some way to partner and make the best decision we can for kids. Thank you.
Thank you for your comments. Okay, to speak against the bill, Pamela Boyd Shields. If you would, please introduce yourself and who you represent.
Commander Pamela Boyd Shields. I'm retired Navy. I'm a mother, a grandmother, and a great-grandmother. And the very first thing I'd like to say is that individual citizens are willing and capable of managing their own affairs without government intervention. And I'm here representing myself. If you pass this bill, I want every one of you that votes yes to it to go to your closest elementary school the second week. I want you to go into those classrooms. Excuse me, gentlemen, I'm talking. I want you to go to each of those classrooms with a second grade teacher, and I want you to see how long those kids keep their mask on. Then I want you to go around and I want you to ask Johnny and Susie, how many days have you worn that mask? Because if you're wearing a paper mask, you need to be changing it every day. They say 4 to 8 hours is how long that mask lasts. And some of you in here have had your mask on way too long. Even if you go home and throw it in your washer, there are some things you cannot get rid of. So I want you to be aware of that when we're dealing with children from the ages of 4, 5 to 12. I believe that every parent in Arkansas, every grandparent that is raising children, is as smart as anybody in this room. I believe I'm as smart as anybody in this room. And for you to say that a school district is smarter than I am is the wrong answer. These children matter as much to me. I joined the armed forces to protect their rights and your rights. But you need to look at the big picture. In a small area that's historically a poor area of Arkansas, do you think parents are going out every day to buy new masks? Are you as a group going to provide new masks for everybody in the state every day? No, you're not. I would expect one or two of you to, when you go into that class with Susie or Johnny, to make arrangements to pick their mask up, send it off to the lab and see what's on it. I'm the person that sent that out to 35 of you. that told about the parents, the 16 parents in Florida, and what were on those masks when they turned them in. One of them was an adult, and he had those things on his mask. So breathing in and out, in and out, in and out and out, you know, you're going to get something. And I just do not think that masks need to be mandated by school boards or school districts. They need to be mandated by a parent that is as smart as you. Thank you.
Thank you for your comments. Representative Mayberry, if you would come up, we have a question for you. Representative Wardlaw, you're recognized for a question.
Thank you, Mr. Chair. Representative Mayberry, if you go to page 2 with me, and I should have done this earlier, and sorry I didn't, but I've sat here thinking through all this testimony. If you go to page 2, line 31, you limit this to 60 days. So roughly 60 days, you're looking at a 3.5-month semester. So you're looking at most of the semester if they voted to mandate a mask in these populations. Are you amenable to lowering those days from 60? Is that an option that you would address?
So yes, so originally my idea was 30, and I'll tell you how I came up with 60. First of all, this is maximum. So a school district could say it's 2 weeks, it's 30 days, it's 45 days. The school district would have those options at their disposal to choose what they think is right there. The reason why I moved it to 60 was because I had someone who is a former school board member say that if you did it at just 30 and that's the maximum, every 30 days this might be topic at the local school board. And that's an awful lot of pressure on that school board to have to constantly every month, if they need to, have to talk about it, and they might not get anything else accomplished in their meetings. And that's why I moved it to 60. But if the agreement or the majority say it should be 30, I'm for that. But that's where that logic came from.
And I'm sorry, but it's going to sound like I'm combative when I say this, but I'm not worried about the pressure at the school board. I'm absolutely worried about the pressure on the kids and the teachers within that school district. So, you know, I do believe that masks, I personally believe they mitigate the spread. I listened to Lee Johnson, who's a doctor. I've listened to the medical experts. I listened to the health department. I do like the fact that your bill highlights the hot points, I guess I'll call them. But I think 60 days is extremely too long. And I think that doesn't put a burdensome on the school board itself to revisit that often enough. Personally, I would feel more comfortable with a 2-week or 30-day time period. That way, at least they're meeting periodically. And if this map changes in that period, then they're able to lift that mandate on those kids at that point. We can talk after the committee, but I wanted to point that out, that I think 60 days is a little bit too long because that's basically almost 2/3 of the semester.
I'm open to that idea. That's just where the advice that was shared with me, and I said, you've got some points there, but we can change that date if that's what I need to do. By all means, I'll be happy to make that change.
Thank you.
Thank you, Representative Mayberry.
Okay, is that it?
Dr. Joe Thompson, if you would come forward and speak for the bill. And please introduce yourself again for the record and who you represent.
Thank you, Mr. Chair. I'm Dr. Joe Thompson, President and CEO of the Arkansas Center for Health Improvement. And I'm here to speak for the bill. I probably like these masks less than anybody in the entire state of Arkansas. I'll just say that for the record. But I'm here to speak for the bill because we are in a new fight and our kids are at risk. This bill, I would advocate, should go farther. The threshold should be lowered to the orange threshold, and it should be extended beyond the call to 13, 14, 15-year-olds that have not been protected. We're in a different place today than we were last spring when this body and the governor's signature handcuffed local decision makers to prevent them from being able to require masks. Representative Miller's comments earlier, I would explicitly point out you took away local decision-making control for protecting our kids. We're in a different fight. Last spring, when you passed that, we had COVID fatigue, you had COVID fatigue, and we saw a light at the end of the tunnel. We were in charge of the parent COVID virus. We have lost that control. The Delta variant is not the same virus. It is attacking our kids. It is attacking younger people. For those that are less than 12, they do not now have a vaccine available. They may by the end of the calendar year. My expectation is that the next 2 months in this forest fire are going to be very, very difficult, and that we will be in a different place in 4 to 5 months. But our locales need the ability, with their decision-making, to put masks in place, to keep the kids in school, to keep the Delta variant from spreading, and for the safety of our kids. Children's hospitals had a tripling in the number of hospitalizations just in the last few weeks. COVID was not a problem for them last year. It is becoming a problem now. And you see it in our hospital numbers for younger adults. You see it in our death numbers, which are almost all preventable, had people moved from an unprotected situation to a protected situation. We're in a different fight now. The Delta variant is more than 2.5 times as infectious. It clearly attacks our younger people and our children, and we're sailing into a school year with your handcuffs on local individuals, and I would implore with you, release those handcuffs so that local individuals can make decisions based upon local knowledge, local control, and local influence. Thank you. I'll be glad to take any questions.
Seeing no questions, thank you for your comments.
Thank you.
To speak against the bill, Kenneth Wallace. Please introduce yourself for the record and who you represent.
I'm Kenny Wallace, engaged citizen, not representing any organization. Videos of this will be on Rumble account Keep Arkansas Legal, also on Parler, Gab, and MeWe. YouTube has politically censored me. I title this speech, Why Government Officials Shouldn't Be Given More Power. I first want to give the kind of the political context of this bill, or say Act 102, that this bill would alter. Act 102 gives local control to parents, teachers, and students. Any change to Act 102 will give power to the education bureaucrats that are politically different than the overwhelming number of voters in Arkansas. This Republican supermajority legislature has already given education officials their way regarding critical race theory, the special election tax increases, and the stoppage of school choice on top of millions of taxpayer dollars. Regarding the treatment of the communist bioweapon known as COVID-19, Dr. Vladimir Zelenko has been using the Zelenko protocol for over a year that uses hydroxychloroquine cocktail. 11 months ago, you had Dr. Simone Gold and Arvin Armstrong in this room testify about using hydroxychloroquine. Actual cases that scientifically superseded CDC study. Regarding the spread of this gain-of-function disease, known as COVID-19, an article from August 1st from Dr. Hurd website states more border agents at Eagle Pass, Texas processing center have tested positive for COVID. Now, although Texas is doing things like passing self-deportation laws and building the wall, nothing is being done on a federal level by the Harris-Biden administration regarding the stoppage of illegal immigration. All our Arkansas government health and education officials seem to have an ignore policy on how much COVID is actually being caused by the movement of illegal aliens, which we know are being bused and even flown to various states. And yet every press conference that Asa Hutchinson's had with his daily report on Tuesday and the community meetings with him and Dr. Romero seem to have more of a lie by omission policy and leaving out the usage of the life-saving drugs, usually followed by vaccines and masks are the only way sales pitch. Now, last I heard, hospitals still won't administer the medicine that has been proven to work. And it seems pharmacies are somehow being bullied regarding the prescriptions of things like ivermectin and hydroxychloroquine. There's also a same lie by omission policy regarding the spread of COVID regarding illegal immigration. Asa was actually asked about this yesterday and only said that it was a good question. A better solution to deal with the COVID issue is to pass self-deportation laws, which reduce not only the number of illegal aliens that may spread COVID, but also narcotics, crime, welfare, dependency, and other negatives. Another solution is to promote the usage of alternative drugs instead of suppressing them. And overall, the Mask and Vaccine Act has been pushed for well over a year, and most people who want to wear them are going to, and most that won't. Masks overall only trap some air and particles and usually can become contaminated unless changed regularly. I believe the former person stated it was for at least 4 hours. Most adults don't even wear them properly. Government officials, local included, have not always acted in the best interest in regards to children or public in general regarding this. We need to do is keep Act 102 the way it is. There doesn't need to be another bill to change it or a supposed compromise to whatever bill to change it. Vote no on House Bill 103. And that's it.
Thank you for your comments. Representative Flowers, you're recognized to speak for the bill.
Thank you, Mr. Chair. I am someone who actually believes that this bill doesn't go nearly far enough. I, of course, come from a different part of the state and a different perspective from those who may be speaking against the bill. I also have had my own personal experiences with COVID and even have had my own personal experience with this variant. A 1-year-old cousin went to the hospital earlier and was contracted COVID or diagnosed with COVID as well as RSV. And he was fighting to breathe while we're fighting with each other around rhetoric. He was 1 year old and was fighting to breathe. Thank God that with breathing treatments, he went home yesterday. But we also know that at least 2 children have died in Arkansas. And I'm very sensitive to how one person, and our first official diagnosed case started in Pine Bluff. And to date, we've now had, in a little over a year's time, over 392,000 people, starting with that one person in Pine Bluff a little over a year ago, and well over 6,000 people who've died. So I want to start this by saying that I don't question anyone's concern for children. I don't even question people's politics. We're here from different political perspectives and from different parts of the state with different needs. What I hope to do is to appeal to you based on this wonderful process that we have here, understanding that I come from a different perspective just as you do, but we come here together to share information, valid information, and make a decision that's best for the entire state. And when I say that this bill doesn't go far enough, I don't believe that there should be a mandate for masks across the entire state, no matter what the numbers say in a given county or city or school district. I don't think there should be a ban on any given municipality or county or school district to do what is best for that school district or county or municipality. And what we have in effect right now is something that ties the hands of other elected officials to address the needs of their local citizens. Now, we say that we value local control. I don't believe that we can agree to a law that prohibits our local leadership from acting quickly in the best interest of the citizens of that area. So I take issue with anyone from anywhere outside of Jefferson County or the Pine Bluff School District or the Dollarway School District who would say that they know what's best for the people in that area. With that, I'd like to make a couple of points, and then I'll be open for any questions. School districts, some of our school districts are under state authority. That's one point I'd like to make. So a lot of this language in every bill that we've seen only points to the school board decision making. What about school districts that are under state authority who don't have school boards? The other point that I'll make is that the bill does not adhere to the tenets of local control for municipalities or school districts. What other entity is more local than a school district? We've talked a lot today about mask wearing. Throughout this pandemic, and even beforehand, I don't know about you all, I was one of the folks who watched the news in past years, or even when I was a kid, and seen people in Asia wearing these masks, wondering, why are they doing that? Because I never had any experience until last year, to understand why. And I say that to say this is not a new practice. It is one of the only preventive measures that we can take to ensure that we might possibly be protecting ourselves from catching COVID. Aside from social distancing, which, by the way, in congregate living facilities and in school environments is near impossible. So understanding that in school environments, it would be near impossible to regulate social distancing as a method of prophylactic measures to address prevention. The only real chance we have of prevention is wearing masks. Now I ask you, why is it that wearing masks, mandating masks, is acceptable for our hospital staff? We don't say anything about that. Nobody over here is fighting to remove the mask from healthcare workers. We don't say anything about the science. Nurses, including nurses in my family, who may have an issue with these masks, say nothing. They go to work and they put them on. Short of quarantining indefinitely, short of emergency shutdowns, masks is the only way that we can prevent. And I'll finally leave you with this. People might say, well, we have the vaccine now and people should be free to get the vaccine and exercise their choice. Children under 12 don't have a choice. Children under 12 can't get the vaccine. No matter what, you don't hear anyone in this room disputing the fact that a majority of the people who are being affected by this variant, which is a mutation that is far more dangerous of the COVID-19 virus that many of us have contracted and understood what it feels like. Children under 12 don't have the choice. Our very first job as legislators in this state body, in this house, is to protect our citizens, especially those who are vulnerable. How in the world we can leave this special session without putting something in place to ensure that the only thing we are aware of to date that could protect them and prevent them from contracting this virus, that they cannot be protected by with a vaccine, would be criminal and an abdication of the duties that we have sworn to uphold. So I ask you, I beg of you, to consider that when you are casting a vote for this bill in this chamber as members of the committee and on the floor when prayerfully we will have something to vote on. Thank you.
Thank you for your comments. Next to speak against the bill, Wayne Beach, if you would come forward. Please introduce yourself for the record and who you represent.
I'm Wayne Beach. I'm representing myself today. And I'm representing all the kids here and all the parents and the grandparents. Representative Allen, I agree with your point that every individual should protect themselves. And I heard several other people say this, that why should I put my kid up to that? What kind of, if you look at what's in those, when they're trying to protect the patients, what are those doctors wearing? Are they wearing those air loop masks? Or are they wearing a zoot suit? Completely covered with their own air supply. Okay, you have, these kids are in class about 6, 7 hours a day. Where are they at the rest of the day? Are they wearing the mask the rest of the day? No, I don't think so. You can't control kids are that small. It's like herding cats. And let me tell you something else. Our Constitution, the first 10 amendments, are individual rights. They don't say rights of the group. They're individual rights. It's the same thing. Thomas Hobbes said, he was a famous philosopher. It kind of was one of the ideologists that kind of helped develop our Constitution. He said that every individual is responsible for their own choices. He said that every individual is also responsible for the consequences of those choices. He did not say that the group is, that you're, in other words, if you want to be saved by Jesus, you have to make that decision. It's a personal, an individual choice. Your preacher can't do it, your mama can't do it, and your daddy can't do it. This is an individual choice. And I guarantee that the parents that I've talked to, they'll tell you the same thing. If you haven't been watching something like YouTube and some of the YouTube videos of the parents that are standing up in front of these school boards and demanding that they at least have a voice, and they're being arrested before they can even speak. And the school board is doing what they want to. Do you trust the school board? Do you trust the group? Let me tell you something. That's called a democracy, and we are not a democracy, folks. We are a constitutional republic. And each individual has those rights. Your rights are protected, your rights are protected, my rights are protected. It doesn't matter what the group wants. It's what your rights are. And I can tell you right now, across over here at the Children's Hospital, they have a bigger problem with RSV than they do with the COVID right now. I asked the governor yesterday in a news conference. I said, Governor, I said, you're the head of the Governors Association, aren't you? He said, yes. I said, can you tell me what the governor, what you're doing and that association is doing to try to mitigate that open borders down here? We have people coming across the border wide open. They're not vaccinated, not checked, or anything else. And they're sent all across our United States. And people in those communities don't even know they're in. They just show up. You see them here in Arkansas, in the restaurants between here and Texas, and they're stopping off. And believe me, You think that virus is going to stop here in Arkansas? You think it's going to stop in Texas as soon as they cross the border? How come we're not closing the border down and telling them to, how long did we quarantine people here in the United States? 10 to 14 days? This stuff is asymptomatic. You've got people that are separating down at the border saying, you look sick, move over in this line. But what about all those people that I slept with and swear, and they actually shared water bottles with on the way up here? And they're they're asymptomatic right now. How do you know that they're not infected? They're not testing, folks. I love Julie Mayberry to death. She's one of my favorite ones. But on this issue, I'm going to say you can't control kids. You're not going to control the virus. You're going to be hurting cats. All I want to say, finish this up with, is I want you to consider you're responsible for your own personal choices and your children's choices, your family choices. Nobody else can do that for you, and nobody else should have that responsibility. And some people may say that the school board, we vote them in to make those choices. Not necessarily. We vote them in to make certain choices, but not choices of our lives, not choices of our freedoms, not choices of our liberties. And we finish up. Viruses will come and go. Liberties are forever gone if you lose them. Do not give those up. Thank you.
Thank you for your comments. Next to speak against the bill, Jan Morgan. Please introduce yourself for the record and who you represent.
Jan Morgan, citizen representing myself. Although I would say that I've traveled over the state about 1,500 miles in the past 3 days, and I've listened to thousands upon thousands of Arkansans on this very issue. I must say that I agree with the doctor who is up here on two things. We are fighting a different kind of fight, and we need to remove the cuffs. But I disagree with him on what the topic of this fight is about. It is not about a virus. And I disagree with him about who's being cuffed. It is the citizens of this state. And it is time that we stop mandating the lives of the people of this state. Let me tell you what I'm hearing around Arkansas. Every single night for the past 3 nights, I have been a keynote speaker at some very large venues. Last night, a parent approached me crying with photos of her young daughter with a serious outbreak all around her face from having to wear a mask. And she said that her daughter's pediatrician said the mask caused this. We can debate the efficacy of mask versus non-mask, vaccine versus non-vaccine, but what we cannot debate today is the individual right of a parent to decide what is in the best interest of his or her child. Republicans, I'm only here because Dallas Green, you nailed it. I don't need to say any more than that. All of the people have spoke, so I'm just going to close out with this. This is a Republican-controlled state government. We shouldn't even be here today having this discussion because our party platform is very specific. When you ran as a Republican and the people elected you to represent them as a Republican, you ran on this platform, and it says that we believe in individual responsibility and initiative, and we believe in individual freedom and liberty secured by a limited government. Increasing regulations and mandates on citizens is not limiting government, it is growing government. That is not what Republicans do, that is what Democrats do. And furthermore, it is the mantra of the other party, excuse me, this is my turn, you can talk about that later. It is the mantra of the other party to say that the government is the solution to all of our problems. No, the government is the problem. We need to stop turning to government to issue more mandates to solve our problems. The other side says, we know better than you what is in the best interest of your child, so therefore we need more government regulations and more mandates. The Republican Party platform says that's not who we are. We believe in individual liberty and individual responsibility, personal accountability. So Republicans, please, stop regurgitating talking points of the other side. The numbers...
I'm sorry, you need to stay with the bill that we're talking about.
Okay, well, I am talking about the bill. This
Well,
bill
we're talking
is...
about parties and...
Okay, this
stick to the
bill
bill.
is limiting the rights of the individual citizen. This bill that we've been talking about today says to parents, the government or the school board knows better than you what is in the best interest of your child and our children at large. Right now, the citizens of this state, every kid in every school can wear a mask if his or her parent wants him or her to wear a mask. Every teacher is allowed to wear a mask. That's called personal choice. The debate here today shouldn't be about the effectiveness of one or the other. The debate here is about whether or not you're going to trample the individual liberty of parents. And I will tell you this in closing. Thousands upon thousands of parents have responded to my social media post about this today, and they have approached me as I've been speaking and listening around the state. And here's what you can expect to happen. Parents are going to pull their kids out of your schools. If you force them to wear masks again, they're going to pull their kids out of your schools. Why? Because they're not going to have jobs because the largest corporations in our state are now mandating vaccines as a condition of employment. So with all these parents sitting at home now with no jobs, they can homeschool their kids. And schools depend on numbers. So school boards that support this notion of forcing children to wear masks all day may come back to bite you in the rear.
Thank you for your
And
comments.
also, last thing, the citizens have asked me to make a list today of the Republicans that vote in support of this bill. And the citizens have said...
You're not speaking on the bill, ma'am. Thank you for your comments.
That is speaking on the bill. I'm telling you what the citizens said about the bill. If you support this bill, they want a list of Republicans who voted for it. And
next, we have Randy Massanella to speak against the bill. Please introduce yourself for the record and who you represent.
Mr. Chairman, Randy Massanella, University of Arkansas at Fayetteville. And first of all, I had to sign up for or against the bill. I'm really speaking on the bill. As you know, you've got the bill in front of you. Specifically, I'd like to point out that on page 1, if you get to line 33, I guess I should put my reading glasses on, it discusses, as Representative Flowers did, public school districts and public school boards. I wanted to bring it to the committee's attention because I know you all have a big decision to make on this bill, whether you're going to pass it or not, or even the General Assembly is going to pass it or not. But I'd ask you all humbly to consider this. The University of Arkansas at Fayetteville, along with 7 other higher ed campuses, and I can list them, we operate a child care preschool facility from kids from the ages of 8 weeks to 5 years old. We offer academic programs in there, child care, and right now we have about 126 students enrolled in that. We have a program like that. Arkansas State has one, Henderson, UA Community College Morrilton, SAU Tech, UAPB, UA Pulaski Tech, and UCA. I just want to bring it to the committee's attention that we feel that these facilities should have the protection as well if you all vote this legislation in, because They do not fall under a school board or school district. In our case, they would fall under the Board of Trustees. But I'm willing to answer any questions about that. I do ask that you consider adding that.
I don't see any questions for you.
Mr. Chairman, thank you so much for your time, and I appreciate all the work you are doing. I know you'll have a tough decision to make, and if we can be helpful in any way, let us know.
Just so you know, I mean, I understand the schools you're talking about and their situations, so I understand that. So thank you for your comments.
Thank you, Mr. Chairman.
To speak against the bill, Catherine Ray. If you would, please introduce yourself and who you represent for the record. Push the button there. Now you're on.
I'm Dr. Kathleen Ray. I'm a biomedical engineer. I have a PhD in biomedical engineering from Tulane University. Currently, I do consulting, but in the past, I have worked in research, science research at UAMS, at Tulane University, at the Swinburne University in Melbourne, Australia. I'm very familiar both with PCR testing and quite familiar with immunology. But I'm here today just representing myself and hopefully just to give you some facts and just what I've learned over the last few years with the research I've been doing that's related to this subject. So I want to start with, I don't know if you guys caught it, but just this week, and oddly on CNN, Biden's top COVID advisor, Dr. Michael Osterholm, stated that, these are his words, the paper or cloth face coverings that many people are wearing today are not effective in reducing any of the virus movement, either in or out. It surprised me to hear that on CNN. Didn't surprise me to hear it. The truth is I never believed that masks could work, and I started looking back on what I knew about the physics of viruses and the physics of barriers, and so I just want to give you some of that information to think about for yourselves. It was determined early in 2020 that the size of the SARS-CoV-2 virus was somewhere between 0.02 and 0.25 microns. That's 1,000th of a meter. Whereas the pores, this is something I know, the pores in N95 masks that you can breathe through are greater than 0.3 microns. So the point being that even with an N95 mask, the virus is smaller than the openings in your mask. Now, then we go back to looking at cloth or paper mask. I don't have the exact size of those pores, but they're definitely larger than what's in an N95 mask. These are just facts. These are not my opinions. Somebody asked me recently, well, if masks don't work, why do surgeons wear them? Keep in mind that surgical masks were developed to prevent the greatest enemy in an operating room, which is bacteria. And I just want to point out that bacterial size ranges from 0.4, which is larger, to 3 microns. They're pretty large compared to viruses are on the order of 1,000 times smaller than bacteria on average. And in fact, if you go to Walgreens, some of the boxes of surgical masks that you can buy for yourself at Walgreens say on the box, does not prevent viral transmission, because they don't. Now, these are just facts. Let's just talk about what happens with, there were also studies, just real quickly, there were studies that looked at this early in 2020 because everybody was promoting wearing masks, and so several universities decided, well, this would be a good thing to study. And I was able to find a paper published in April of 2020 in the Annals of Internal Medicine. And the determination of that paper was that neither surgical nor cotton mask effectively filtered SARS-CoV-2 during coughs by infected patients. Basically what they did was they took people who were definitely sick, had symptoms, had tested positive for COVID. They had them cough they had Petri dishes that would support viral growth. And they had them cough on a bear on a Petri dish. They had them cough using a surgical paper mask. They had them cough using a cloth mask that you can buy now in the stores or make yourself. And it turned out that the amount of viral load on each of those dishes was the same. So, there's a point to support the physics of viral transmission through barriers. The thing that was alarming to me about this study was, we've been taught that masks were promoted also because of aerosols, right? We know it's an aerosol. And we all saw the little graphics that were on TV commercials. They were on Facebook computers of people talking without a mask, and here's the aerosol droplets coming out of their mask, and then here's the mask on, and the aerosol droplets are not coming out. Well, in this study, they accidentally found that aerosols as large as 3 micrometers, much larger, were able to penetrate the mask, both kinds. And in fact, here's the killer, is that then they examined the masks themselves, and this was only after just a few minutes of wearing, 3 minutes tops. The contamination of the virus on the outside of the mask was greater than what was on the inside. So really they don't work very well. And you can look at this statistically as well. As you might know, Sweden declined to do any mask mandates or any lockdowns. And of course, they were just vilified for that early on. Sweden, I've looked it up, population-wise, it's the same size as the state of Michigan. So currently in Sweden, the death rate was 14,000, supposedly death rate from COVID. In Michigan, it's 21,000. And Michigan was one of the states that had the most severe, what I would call actually draconian lockdown measures. So there's that. Now, the other thing is, the second point is that children really are not much at risk of COVID. We've heard testimony to the contrary, but I just want to say that from the CDC statistics, the mortality rate of people under age 17 is about 0.06, and that's of those infected. The infection rate also is similarly small. So you're looking at a pretty low risk. And as of last May in the United States, deaths in this age group tallied up to 9, 6 of them with underlying conditions. That data actually is from the WHO. So I don't believe children are at a great deal of risk from COVID or from the Delta variant, and I'll come back to that. My third point is that really asymptomatic spread is kind of a myth. It is so rare as to be a myth, and it's not been adequately documented. There's actually no scientific verification of asymptomatic spread of the virus. That means if you're not showing symptoms. Now, and there's interestingly certainly been no documentation so far of spread of the virus from recovered people. So unlike the 75% of people who got sick in, I think it was Princeton, Massachusetts, 75% of those people, it turned out, were vaccinated. Not surprising. The vaccine doesn't prevent you from getting the virus. A vaccine prevents you, hopefully, from getting very sick when you come in contact with the virus. So it's not surprising that you might come in contact with the virus and you might give it to others if you're vaccinated. However, there have been no documented cases of anyone who got COVID and recovered from it and later gave it to someone else. None that I can find. So the fourth quick point I want to make is that I've done a lot of research on whether masks are safe for children. there was that Florida study. My notes that I brought today relate to a study in Germany. It was very recent. They looked at 25,930 children. Among those children, 68 of them reported breathing problems from having to wear a mask all day in school. The average wear of the mask was 4.5 hours a day. So 68% had breathing problems. 60% of parents agreed with that there were breathing problems that their children were experiencing. The parents reported for their children, 53% of them had headaches, 20% had episodes of dizziness, and more than 50% had learning impairment. So there is some risk, I think, to asking children to do this every day. And these things relate to hypercapnia, which is when you have too much breathing and too much CO2. So it turns out that, the mask does create, you don't wear it like glued to your face. There is a little bit of airspace in front of the mask, and that's just an ideal little capsule for hanging on to the CO2 that you're exhaling. And it's just a fact that you're going to rebreathe some of that CO2. So how much? Well, there were some studies that looked at that. Well, let's see. I'm sorry, I'm looking for that number. Yeah, here it is. So normally the amount of CO2 in a nice big open room like this, well, and outside in open air is going to be 0.04% CO2. In an enclosed room, it's usually going to be about 0.1%. The level that's considered safe is 0.2%. All right, so there was a controlled experimental study that was reported in the Journal of American Medical Association Pediatrics recently. Let's see, it was June of this year. They measured 3 minutes continuous measurements for kids, young people wearing masks. They used, the mean age of children was 10.7. It was kids aged 6 to 17, 20 females, 25 males. What they found was the average amount of CO2 that was inhaled during those 3 minutes with the mouth and nose covered was 1.3 to 1.4%. So we're already getting above what's comfortable in 3 minutes. And school children, on average in the U.S., wear these masks for 270 minutes. So it's not surprising that in over 25,000 children in Germany, more than 60% of them were reporting breathing problems, headaches, dizziness, and an inability to concentrate in school. So my point there is that masks are not healthy. And that Florida study where they measured all the different type of bacteria that were found on the mask, that was a pretty valid study too. And I won't bring that up because someone already has. My main point here is that you're here to represent your constituents, your voters. Some of them are parents. And I don't have children myself, but if I did, I really wouldn't want a school board making a decision that I feel would affect my children's health. I think that should be totally left up to parents. And along those lines, so many of you in here are wearing a mask, and that's fine. I'm not here to convince you to not wear your mask. I'm giving you the facts as I know them and the research that I've found. But you shouldn't be imposing that on other people. It's been stated several times that we have a constitution, we have individual rights, and parents are the best people to decide what's best for their children. I'm going to ask you to consider not passing that responsibility on to people who are not the parents of those individual children. I'm happy to answer any questions.
We do have a question. Representative Dodson, you're recognized.
Thank you, Mr. Chair. We're kind of to your left here.
Hi.
So I find myself intrigued by some of your data, and I missed, what was your name again? I'm sorry.
Kathleen Ray.
And what's your occupation?
I'm a biomedical engineer. I do consulting right now. I have been a research scientist at UAMS, at Tulane University, at Swinburne University in Melbourne, Australia. I've taught, I've been a professor at UALR and UCA.
I notice you have a lot of notes. It looks like they're written down. Is there any place that all of these are compiled together that you could share with us? Because this information is the most concise I've heard.
I'd be happy to email you, make it a little more legible. This is kind of my scribbles I did this morning and last night. Yeah, I mean, I'd be happy to email you what I've presented today, and in fact, if you have any other questions, I'd be happy to help you find answers to those.
Excellent. And then finally, in your opinion, you seem to be very knowledgeable about this.
Yes, she does.
If a child's wearing a mask and they're exposed to a child not wearing a mask, are they protected?
Well, in my opinion, your mask does not protect you against viruses. I'm sorry, that's actually not my opinion. That's the physics of the size of viruses versus the size of the pores in your mask. There's also data supporting that wearing a mask is not healthy. It's the CO2 accumulation and the bacterial contamination and these types of things. So I don't think it buys you anything to wear one, but I do think that people, a lot of people don't make decisions necessarily on data or what I would consider logic. People make decisions based on their feelings about things and what feels right for them. So I don't deny anybody's right to choose to wear a mask.
Someone wearing a mask versus someone not wearing a mask, it offers no greater protection or less protection, but it kind of gives you peace of mind.
Right.
Thank you.
We do have another question. Representative Bentley, you're recognized for a question.
Thank you. I'm up here. Thank you so much for being here and sharing us some good data. We're all concerned about our constituents, especially our kids. So since you've done some research and we're seeing that masks aren't effective, can you tell us some things that might be effective for kids that we could share on to help stop the spread of this? Because we would really love to see some stopping.
You know, that's a tough one. The thing is, the current data, I mean, really, as you probably realize, we're pretty much over the hump on the alpha variant, on the original variant. And the truth is that this virus followed the pattern of just about every other virus that's ever been on the planet as far as the infection rate, you know, the peak. What we did with the shutdowns and the social distancing was we moved that peak over a bit and drug it out. But the thing that actually happened was it was probably the same number of infections that we were going to get if we'd done nothing. I mean, just based on the mathematics of the numbers I've seen. Now, how do you protect children? Well, the data support right now that the Delta variant is quite contagious on the level of, say, chickenpox. Now, I'm 61, and I don't know how, you know, you guys, I had chickenpox in kindergarten, and you may or not remember it's highly contagious if you're not vaccinated, which we weren't back then. And, you know, in kindergarten, one kid got it, and it went all the way around the room, one to the next, because it's highly contagious. So that's true. The question is it dangerous? So the data that we got from day one of when CDC started collecting and reporting data, to me indicated that there's very, very little danger to young people for even the original highly virulent alpha variant. And the data now we're seeing is that the Delta variant is less dangerous even to adults. This is statistically, I'm just looking at the numbers. So my feeling is somebody, I don't know if it was you, but somebody mentioned, you know, why don't we just let children develop natural immunity? And I'm all for that. It's more effective, and let me, if I can talk another minute, a question has come up about the vaccine versus natural immunity. In fact, a medical representative here today stated that the vaccine was more effective than natural immunity, and personally I think that's incorrect. Everything I've read, everything I know from my studies in immunology and all the research that I have done, both prior to this active research and then the reading I've done, that is incorrect. Once you get a virus and you overcome it, what has happened in your body is that you have, of course, developed antibodies. Now, people are saying, oh, the antibodies, they are less apparent, they're less available after a certain amount of time. Well, of course they are. I mean, do you really think that for every single cold, every single flu, chickenpox, everything you've ever had in your life, that you still have that same high level of antibodies floating around? I mean, what you do have is you have memory T cells, and their job is to recognize when you see that antigen again, when you see that danger again, and then call up and start producing those antibodies, those soldiers, to go to battle against that virus. This is how your immune system works in a very simplified version. So here's my point. If you got the virus and you got over it, there's a 100% chance that you developed antibodies. I hope you'll agree with that. And of course that you have these great T cells, which they're just waiting to help you out there. If you got the vaccine, the data coming back from the three main vaccines, the chances are somewhere between 60 and 90%, I'm going to say 85%, that you have antibodies. Because as we know, vaccines are not perfect. Your body that fought off the virus, that's 100%. Your vaccine's not 100%. That's one thing. The second thing is, as I just stated, the job of the vaccine is to keep you from getting really sick. It's not a magic bullet to keep you from not getting the virus. That's not how they work. Depending on your immune system, depending on how well your vaccine is working, depending on your general health, whether you've got risk factors, lots of things in there. That's all going to depend. That's all going to affect how well you overcome the virus, even if you're vaccinated. So saying that vaccination is a better tool than natural immunity, I completely disagree with that.
Could I do one real fast follow-up, Chairman?
Real quick, we've got other questions.
All right, real quick. So would you say that we really might have done our children a disservice last year when we masked everyone and we didn't allow and quarantined everybody and it didn't allow them to get some natural immunities? Do you think, in hindsight, do you think it might have been better just to allow our children to get natural immunities and so they would have more protection this year against the Delta variant?
Okay, so I just want to be clear, you're asking my opinion. So
yes,
now I'm going to give you my opinion. My opinion is yes.
Thank you.
Representative Pilkington, you're recognized for a question.
Thank you, Mr. Chairman. You made the claim that there's no studies that show that there's asymptomatic spread of the COVID-19. That's factually not true. JAMA has a study. The University of Chicago Medicine has a study. I mean, there's multiple ones out there. So that wasn't factual when you said that.
I think I may have misspoke. I didn't mean to say that there were no studies showing it. I said it's so rare as to be a myth. If you look at the studies and you believe, you feel very certain about that study, I mean, depending on the methods, and then you look at the overall picture, it's extremely rare.
Well, then you made another claim, too, that you didn't think masks were effective. But no one is claiming that a mask is 100% effective. I mean, obviously, the larger droplets that carry COVID do get stopped by the mask because their microns are larger. So, I mean, you've made two statements, I think, that present masks as being completely useless, which is not true. And I'm worried because there's so much misinformation about COVID that we're muddying the waters here. Let me put it that way.
Let me clarify that. Yeah, so masks do stop the aerosol droplets, although in the one study I saw, they did see pretty large aerosols still coming through. But aerosol, so droplets of water, we'll call it water, are held together by surface tension. You can picture a raindrop held together. Once that raindrop hits the hood of your car, that surface tension is destroyed. You know, it's now, and anything that was contained in that droplet before it hit a surface is no longer contained. So say you had, 100 little virion virus particles in a droplet of your spit or your respiration, and then that droplet hit the inside of your mask, is no longer a droplet. If it were, the inside of your mask would fill up with droplets of water, which we know doesn't happen. So whatever was in that droplet is no longer in that droplet. It's on the surface of your mask. And because your mask has pores in it that you're breathing through, and those pores are larger than the virus can easily go on through your mask. In fact, you can breathe it into your mask from other people. Does that help? Okay.
Representative Ferguson, you're recognized for a question.
Yeah, I'm like Representative Pilkington. There's been so much misinformation presented by you, I don't even know where to begin. Are you aware that the JAMA article that you quoted about carbon dioxide was retracted?
Yes, I'm aware of that.
And to his point, it's not about the virus size, it's about the particle size. I mean, it's
the particles of what?
The droplet size, not the virus micro.
Right, yeah. And I just explained
But you just, I mean, it's just so much misinformation, I don't even know where to begin.
I'm sorry you feel that way.
Well, I, for one, am very interested in what you said about mask and the size of the mask. Speaking as someone who's mandated mask in an industrial setting, the mask has to be designed for the chemical or whatever. And again, I'm talking about chemistry and not medical, so I don't know anything about viruses. But I know if you're protecting someone against chlorine or whatever, you know the size of that molecular chemical, and your mask has to be sized to stop that size of a molecule, right? So I understand that, and if the mask is not designed for the particular element that you're trying to stop, then it's ineffective. I think that's what you're saying.
Yes.
And if you do not train the person on how to use that mask and fit that mask, it's ineffective. And it gives you false confidence that you're protected from something when you're not.
I would say so.
So I think that's what you were trying to say, and I appreciate the science of that. Of course, here we're not dealing with science, we're dealing with kids, which is opposite end of the spectrum probably. But appreciate your input on that.
Thank you.
Do you have another question? Representative Allen, you're recognized.
Thank you, Mr. Chairman. Thank you, Doctor, for being here. I want to know how many child deaths makes herd immunity worth it?
I'm not here to make policy. I'm just presenting data and facts, science facts.
But in that data too? In deaths part of data?
I'm sorry, I can't understand you. Could you repeat that?
Isn't a death part of data?
Yes, sir, but it's not up to me to decide what the risk should be. I feel that it's up to each parent to decide how they want to best protect their children.
Well, if I recall, you expressed an opinion a few minutes ago, so can you give us an opinion on this?
My opinion is that natural immunity is a safer method, and if I had children, that's what I would choose. I can't choose for your children. That's what I would choose for mine.
Thank you.
All right, seeing no more questions, thank you for your comments.
Thank you.
Representative Mayberry, are you ready to close for your bill? If you would, could you bring up the doctor that was with you when you presented? We have a question for her before you close. Representative Eubanks, would you ring in? Representative Eubanks, you're recognized for a question.
Thank you, Mr. Chair. Doctor, I can't recall your name, but I
It's
just...
Dr. Young, Heather Young.
I am totally confused because like everybody has a position on this. I've heard, I've talked to doctors, I've talked to pharmacists, individuals. We just heard testimony from a biometrical engineer who had some very convincing arguments to make. Can you refute or answer any of the things that she stated there?
So I can say that the article talking about the high CO2 levels in children was redacted due to concerns based off of the study process itself. I mean, I can pull up the actual letter for why it was redacted. So there's no evidence that children are getting high enough levels of CO2 from wearing a mask that it is causing any sort of damage, period. All right, so if you, in an experimental lab setting, can you make it to where some viral particles blow through a mask? Yes. In the real world, what we are seeing, and there are several studies that show this, and I am happy to send them to you. First, one of the first big studies that we saw was as far as containing the virus from the person or the source. There was a couple of hairdressers somewhere in Missouri. They wore masks. They cut over like 60 people's hair during times that they would be considered infectious. None of their clients contracted COVID. And if you are a woman getting your hair cut, you're there for a while usually. So that's one huge piece of evidence that source control works. Secondly, there was when the USS Theodore was having its outbreak, they instituted masking and their rates fell. So and I have plenty more ones to share with you about all of this, but the actual on the ground evidence, I can even say within the hospitals that I work in, we have had very little transmission of COVID in the hospitals when masks are being used. You would think that if you have a whole bunch of people who live out in the community and then come into one building and are working around each other, that we ought to be a huge hot spot. And that was actually one of the big concerns in the beginning, and that's why we shut down elective surgeries and we told people not to come to the hospital in the very beginning. We started letting parents back, we started letting visitors come in and everything. We're not seeing, everybody's wearing a mask, we're not seeing spikes in cases and transmission from those people. We're just not seeing it. So the one thing that we have seen, yes, there have been a few spikes that were early on in the fall, et cetera, and back in November and December when we were seeing spikes of COVID cases in kids. But when you compare our respiratory viral season, so all the other viruses aside from COVID, your RSV, your influenza, all of that stuff, our hospitals were dead as far as pediatric patients. There were no patients being admitted. I worked on Christmas Day and I had 3 patients in the hospital and that was it. That's unheard of in the winter season in pediatrics. Then as soon as the mask mandate kind of relaxed back in April and May, we are admitting kids with respiratory distress who not only have COVID, there are kids who have COVID, but then there's also kids who are positive for 3 or 4 viruses. And we're seeing them, they're positive for parainfluenza, adenovirus, and RSV. It's kind of like our magical cocktail of viruses that these kids are being admitted for. I mean, I'm telling you in the real world that we are seeing that masks work. And I can give you scientific studies that have not been redacted that show that they work.
Follow up, Mr. Chair.
Yes, you're recognized.
Have you had to treat any person for wearing a mask or that as a result of wearing a mask?
Other than a little bit of mask acne that's treatable and not life-threatening, That's the only condition I've had to treat somebody for wearing a mask, but nothing that is life-threatening or would require hospitalization.
Thank you, Mr. Chair.
All right, thank you. Thank you for those comments. Representative Mabry, are you ready to close for your bill?
I just want to say one final thing, that I understand as a parent, I can tell my children who are in high school, I want you to wear a mask in school. As a matter of fact, this came up at dinner time recently. My kid said, "Mom, are you going to make us wear a mask?" And I said, and this was a few weeks ago, and I said, well, if cases continue to increase, then, probably yes, I'm going to make you wear a mask. And they have no problem wearing a mask. It is not a big deal. Not a big deal to them at all. But they said, if no one else in the classroom is wearing that mask, it's going to be really hard to wear it. Imagine the peer pressure that's in that classroom. I understand parents should have the right to tell their child what to do and not do, but the peer pressure going on in those classrooms will stop some kids from putting it on. It almost stopped me the other day when we had a meeting of legislators. I had to sit there and think about it. I'm walking into a room. I'm probably the only one walking into that room wearing a mask. And I actually considered, wow, this is a hard thing to do, and it shouldn't be. But it was. And I did it because I know in my situation it was the right thing to do at the time, but it certainly makes it easier when other people are joining you. I'm open to ideas. This committee knows I brought another problem to you that seemed like it was an impossible task to solve. Everybody had a different opinion. I'm willing to work on this, take feedback. I don't know what this committee wants, but I would love the opportunity to work on some amendments based on feedback and come back with something that might satisfy a few more people.
So are you closed?
I'm closed.
What's the will of the committee? What's the will of the committee? Have a motion, do pass. Is there a second?
We don't have to have a second.
You have a regular committee, don't we have a second? In a regular committee, you have to have a second. I'm confused.
No, you don't have to have a second.
You're right, Representative Allen. All right, motion is do pass. Any discussion on the motion? Representative Eubanks, you're recognized.
Thank you, Mr. Chair. I don't think this bill's going to pass. I have some personal issues with it, but given the fact that this is the only thing that I have in front of me, I really am conflicted. I've heard a lot of people testify today about personal freedom and that the parents are the best individuals to make the decisions for their children. I serve on a CASA board, and for those that don't know what that is, that's court-appointed special advocates. And unfortunately, I've learned too much about the people in my communities and the decisions that they don't make for their children. They don't feed them, they don't clothe them, they don't bathe them. Too often, they abuse them physically, sexually, emotionally. And more of that has been pushed off on the schools to try to fix. We have backpack programs, we have everything that, and I've served on the school board, so I know the kids and the number of kids that are coming to school, and they don't have the proper supervision of responsible parents or adults in their lives to take care of them. And unfortunately, the schools are being forced to make those decisions for them and try to make the best decisions for them. So I'm not too impressed with the people that are making the argument that the adults are the best persons to make those decisions, because I see way too many of them that aren't doing that. I do not, like I said, I do not like many aspects of this bill, but, and right at the moment, I don't know how I'm going to vote. But I don't want to be responsible for a child being hospitalized or potentially dying. I had 2 grandchildren that were in the school district last year, and a kindergartner and a preschool. They didn't have an issue wearing the mask. Of course, my daughter is a responsible individual and had several of them, and as they brought home one, they washed that one and they had them hanging up, and so they had a new one each day. But I suspect she's probably the exception. So I've talked to many medical people that say the mask mitigates the spread of the disease. And I don't know anybody that's been hospitalized or treated because they've had to wear a mask. So, thank you, Mr. Chair.
Any other discussion? Representative Pilkington, you're recognized.
Thank you, Mr. Chairman. And Representative Eubanks, I appreciate your comments on this. I think that's very well put. You know, I don't necessarily like this bill either. We had a very frank conversation the other day. There's things I like. You know, I think I've told you my fear is whether we mask or we don't mask. I still think sending kids to school right now when we're in the most rampant uptick in the Delta variant is a bad idea. I'd rather push it back. I think that'd be way better. It's a way to make sure that our health resources don't get stretched too thin, which we're already told by every hospital administrator in the state that they're getting stretched too thin. I think compliance is an issue, and this doesn't address that. I'm not in favor of this bill because I think there's too many issues that need to get worked out. And like I said, I think we can pass this, and if we pass this and the kids go to school, I still think we're going to have outbreaks, and we're going to say, well, we should have done more. We should have done more. And you know, there's a certain amount of risk with COVID that we have to live with. And COVID is very real. We should be getting the vaccines. You know, we tried all these incentives in the world to get the vaccine, to get people to take the vaccine, and yet the biggest day was the other day with no incentives out there, in which 1% of the whole state of Arkansas went out and got vaccinated. I like to trust the people of Arkansas to do the right thing, and I think we should give them time to make the right decisions. But that's my opinion, and I'll be voting no on this because I don't think this is the right answer at this moment. Thank you.
Representative Ferguson, you're recognized.
Yeah, I'm sort of hearing the same thing from everybody. There are also, you know, I certainly maybe would like to see the 60 days reduced to 30 and maybe the 50 cases per 10,000 reduced a little bit to allow a quicker response. I guess maybe at this point, is it allowed, would you be able to pull the bill down and let us do a few amendments that might get people where they need to be? I hate to defeat the bill, which sounds like what might happen.
I would be happy to do that. I would be happy to pull it down, get this feedback. You all talk to me. I am more than willing to hear what you have to say.
Representative Mayberry, I think the questions that have been raised and the suggestions that have been given to you, and you're willing to look at those, it might be in your best interest to pull the bill down and tweak it and bring it back. That's up to you. She can pull it down. Oh, you have to retract the motion, yes. Right. Sorry. The person who made the motion has to retract the motion. Let me get you on here, Mr. Representative. Okay, you're recognized, Representative Bell.
Before I do that, I'd like to say something. Yesterday, we had 27 daycare centers to close. Those daycare closures represented over 1,800 children that cannot go to daycare today because they were exposed to someone with COVID. That also translates to parents that could not go to work today because they didn't have backup options. I strongly suggest that we take a look at this and try to come up with something that's workable for everybody involved. So with that, I would like to withdraw my motion.
Thank you, Representative Allen. That's a valid request. So his motion has been withdrawn, so you can work on the bill and bring it back, if you would.
I'd be happy to do so. Thank you, members. This is an important conversation, and I appreciate you spending 3-4 hours, whatever it is, listening to it today. Thank you.
All right, thank you. Committee, that's the last thing on the agenda. So we are adjourned.